Good afternoon. We're going to just get started in just a few seconds. So if you don't mind just taking a seat, wrapping up the conversations, and we'll get started in just a little bit. All right, we're going to go ahead and get started. My name is Yulia Van. I'm the Public Health Director for Allegheny County Public Health Department, and I will be chairing this hearing on behalf of the Allegheny County Board of Health. This is the 2nd of June, 2026. It is 5:30 p.m. We're in the Allegheny County Gold Room in the courthouse, as well as on Zoom. And this is set by the Board of Health for a public hearing on the Allegheny County Health Department's proposed Article 24 regulation on paid sick and parental leave. During their May 13th meeting, the Board of Health voted in support of a 30-day public comment period for this regulatory update and change. Public notice of today's hearing was published in the Pittsburgh Post-Gazette on Sunday, May 17th. The notice contained a summary of the proposed regulation and advised the public where to examine copies and how to submit written comments. A copy of the proposed regulation is also available on the Public Health website under the Board of Health public meeting schedule. A copy of the proposed regulation, an overview of notable changes, and instructions on how to submit written comment are also available on the ACHD Allegheny County Health Department's website. And now I'm going to pass it over to my colleague, Ms. Kim Joyce, our Chief Operating Officer in the Health Department, to walk us through the procedure and protocol of this public hearing. Ms. Joyce?
Good evening. I just want to review the process for public comments at this hearing. First, for those of you who have prepared comments today and have signed up to share them, we thank you. We value your input. Each speaker will have 3 minutes to present. Speakers will receive a spoken notice when they have 30 seconds remaining and when their allotted time has ended. Dr. Van will call up approximately 3 speakers at a time to the podium if you can line up and be prepared. We do have a packed schedule this evening. During your comments, our job is to listen attentively. You will notice that ACHD staff will not respond. We simply listen. The department will respond to all comments, both those submitted in oral testimony today and those submitted in writing after the close of the public comment period. Public comment is an opportunity for members of the public to inform the governing body, in this case the Board of Health, about their views. The role of the public is to provide input to the Board of Health, which takes your input into consideration when making decisions. The purpose of today's hearing is to compile oral testimony. If you would like to provide comments after this hearing, you may do so in writing before the end of the public comment period, which ends at 11:59 p.m. on June 16th. After the public comment period ends, the Health Department will collate all public comments, both written and oral. The department will prepare a response document that includes a summary of all comments and ACHD responses. All comments will be fully considered prior to final action being taken. This response document will be made available to the public. It will be presented to the Board of Health along with any proposed revisions to the regulations of Article 24. Again, thank you for taking the time to share your comments with us today.
Thank you so much, Ms. Joyce. I do want to highlight two more things. We do have a very large group tonight, and everybody is entitled for 3 minutes, so please feel free to utilize your 3 minutes. Ms. Joyce is going to keep a timer. However, if you do not need the 3 minutes, that is perfectly fine, so we can get everybody to speak. Also, I will call out 3 people that are here in person and 1 on Zoom, and we'll alternate between that so everybody can go through. So the first 3 speakers in the room that we have are Sarah Murphy, Armin Sami, and Jeff Schroeffel. And on Zoom, Amanda Denham. So do we have Sarah Murphy? Thank you.
Hello, my name is Sarah Murphy, and I'm a community health advocate, and I'm also a mother. I actually wear a lot of hats, but today I'm here on behalf of a woman named Evelyn Murphy. Evelyn Murphy gave birth to a baby alone in October 1976. She was an RN at Mercy Hospital. She hid her pregnancy the whole time. When she just went into labor, she was at home alone in a house in North Braddock. She gave birth to this baby in October and took the baby behind a mall. The mall now is where the Amazon shipment center is in North Versailles. The mall at the time was Eastland Mall. So Evelyn Murphy put this baby behind the mall, and then she went to work at Mercy Hospital as an RN, on her feet all day. When I asked her why she made the decision that she made that day, she basically told me that she didn't have any time off from work. She had just started her job at Mercy Hospital as an RN. She was one of the first Black RNs there, and she was also a mom to me. She was a single mother, and so she was raising me alone, and she gave birth to this other child alone in a home by herself. And so in 2019, I found that child. And so we appeared on a television show called Long Lost Family, TLC's Long Lost Family, season 6, episode 8. You can watch that and see when we reunited. But I feel like if my mother had the support that she needed, if she had paid parental leave, she might not have made that decision that day. And I want to fast forward to myself as a mother. I worked 2 jobs, and when I had my son in 2012, I didn't get any parental paid leave either. So one of my jobs was actually a child care. I worked in child care facility. So I mention that because a lot of women work in child care facilities. A lot of women take care of other babies and don't have paid parental leave. And I will say that fathers need that as well. And so we as a community, as a state, we've been at the forefront of legislation and policies that impact women and families for the better. This is something that we need to push through for that as well.
Thank you. Armin Sami. Jeff Schroeffel? No. All right, we'll go to Zoom. Do we have Amanda Denham? All right. The next 3 round of speakers, we have Adrian Andrews, Tim Gardner, and Ashley Commons. And then on Zoom, we have Mandy Stewart. So let's see, do we have Adrian Andrews? No? Okay. Tim Gardner. Ashley Commons. She is here? Well, okay, if there's anybody that was signed up that I have on the list that is not here yet, are people having a hard time going through security, or? Yes. Okay, all right. Do we have Mandy Stewart on Zoom? No, all right. The next three, we have Tanisha Long, Silas Russell, and Hannah Standiford. Do we have Lillian Miller on Zoom? Okay. Is Tanisha Long here? No? Silas Russell.
Okay, let's go, buddy.
Welcome.
Hi. I'm Silas Russell. I'm the Executive Vice President and Policy Director for SEIU Healthcare Pennsylvania. We're the largest healthcare workers union in the state of Pennsylvania. This is Bruno. You want to say hi?
Hi.
Hi. Good afternoon. So on behalf of the nearly 5,000 nurses, hospital workers, nursing home caregivers, and home care providers in our membership who live and work here in Allegheny County, I'm here today to urge your full support of the proposed 18-week mandate for paid parental leave. The vast majority of our members and healthcare workers in this county work for $2 billion conglomerates. In fact, between our two big health systems, they employ 10% of our workforce in Allegheny County. Across these two major employers, workers are provided 2 weeks of paid parental leave. These are the workers who care for our community. As a Board of Health, your mandate is to protect and improve public health. Paid parental leave is a critical public health intervention. The medical evidence is undeniable for the health and welfare of mothers, children, and families, as I expect many to speak about tonight. But I want to address, as a union representative representing healthcare workers, that we must also address the severe workforce shortage that is currently crippling our local hospitals, nursing homes, home care system, long-term care system, a shortage that directly threatens the public health and healthcare availability in our region. We cannot separate our staffing crisis from the fact that the healthcare workforce is overwhelmingly powered by women. About 3/4 of our membership is women, and approximately 60% of our membership are birthing age individuals. When we do not provide paid parental leave, we lose vital workers at the exact moment we need them most. Data from the U.S. Department of Labor shows that the first-time mothers who do not have access to paid parental leave face a staggering 34% probability of quitting their jobs entirely. In sharp contrast, those workers who do have paid parental leave benefits have a 92% probability of returning to the same employer after their birth and leave period. Compare that 92% retention potential to the reality our local hospitals are facing right now. According to data from the Hospital and Health System Association of Pennsylvania, the average statewide nurse vacancy rate remains at a critical 14%. Almost, you want to speak? Almost when I'm done, you can speak, okay? Okay. While hospital nurse...
Daddy, excuse me, Daddy, when you're done speaking,
Yeah.
can I watch
Go ahead.
Paw Patrol?
Yes, that's really important. While hospital turnover hovers around 16% nationally, Pennsylvania has the worst nurse turnover rate in the country. So when we lose nurses and other hospital workers at the bedside, this is what causes our ER wait times to skyrocket. When I take Bruno to the ER with a respiratory illness and we have to wait for hours before his oxygen can be addressed when it's below 90, that's not what we should be having, and it's a shortage of workers, and when we lose workers because of parental leave, that hurts us all. Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you. Do we have Hannah Standiford? So we have a lot of people that came into the room, so I'll go back to some of the speakers that I have just called that were not here and see if anybody came. So Armin Sami, please.
Hello, with apologies for being late. Armin Sammy from Pittsburgh. I live in Friendship. I want to speak in support of paid family leave. I'm a small business owner, and I own 2 businesses that operate in Pittsburgh. One of them I'm self-employed. I want to stress that I'm in support of paid family leave, but this bill is internally inconsistent, lazily written, and has led to a lot of confusion. As written, I think it would harm small businesses. If the exact proposal text is passed today, I would begrudgingly support it. I'm hoping that through this process, you can get me to a place where I can strongly support it. I want to present my critiques, but again, I am in support of paid family leave. The proposal seems like it was copied and pasted from HB 906 in the PA General Assembly. That bill is well thought out. In particular, it creates a department that manages paid family and medical leave. It creates a payroll tax that everybody must pay into. Private businesses can opt out if they can prove that they still will have paid family leave benefits. It creates rules for how the taxes should be. This proposal in front of us does none of those things. It's a tax, but it feels scared to call itself a tax. It's a tax on small businesses without a lot of the public benefits that we expect from a tax. 2 sections in particular, section 3310 says that an employer is allowed to get a private plan, but there's no public plan, so it doesn't really make sense why it's talking about something that would be allowed anyway. Section 3503 talks about a self-employed option. Again, there's no public plan, so it's not really saying anything when you talk about a self-employed option, like what are you opting into? So a lot of this proposal only makes sense if you also offer a public insurance option, just like unemployment insurance, just like disability insurance. I looked into getting paid insurance, private insurance for my business for paid family medical leave. What I found is that everything I found requires a minimum of 5 employees and caps out at 12 weeks of paid leave. So obviously that doesn't work for my small business, and it does not work for the 18 weeks proposed here. If we had a public plan, or at least something that Allegheny County had a bid for proposals on so that we could opt into something as a small business, as a self-employed person, then we would be able to opt in, pay a monthly fee, and then not have to bear the weight of somebody going on paid leave and having to incur the costs all at once. This bill feels like a first draft. I hope that the second draft copies a few more of the great ideas in HB 906. And again, I support it today begrudgingly. Please help me support it enthusiastically. Thank you.
Thank you. Do we have Jeff Schruffel in the room? No. Do we have Amanda Danham on Zoom? Adrian Andrews? Tim Gardner? Ashley Commons? Please, Ashley.
All right, good evening. My name is Ashley Comans, and today I am here to show up in my capacity as board chair of Catapult Greater Pittsburgh. At Catapult, we focus on pulling people out of poverty and work towards economic justice for our communities. Catapult Greater Pittsburgh's core principle is to ensure systematically disenfranchised people can meaningfully achieve economic justice and lead dignified and equitable lives. As board chair, I've had the pleasure of working alongside our organization's CEO, Tammy Thompson, and watching her lead a team providing programming that has been life-changing for community members right here in Allegheny County. A key piece to success we get to see is internally applying those same values for the staff of Catapult. Just to start from a small employer perspective, we can do this. It is really a benefit. One of our employees, Brittany, she has been with our organization since its founding. She has recently had 2 children while employed with Catapult Greater Pittsburgh, and both times has received 12 weeks full pay of parental leave. That is something that Brittany has said was life-changing for her, and specifically said, someone would have to drag me out of here to leave this employment. To have that security to know that she can go have her children and come back to work and get right back to business is not only beneficial for her, but is also beneficial for our organization and being able to support our employees during such a transformational time in your life. And then our CEO, Tammy Thompson, when making the decision to offer this to her employees as a nonprofit of a small employer, she simply said, "It's in my budget to pay my staff all year round. So when my employees are expecting, we continue to support them through that time. And it also allows us to feel supported in that retention, because it actually costs more to hire new employees than being able to maintain the staff that we currently have. Our board meetings discussing the importance of taking care of our own team. Staff retention is not an issue here. I know our team members will always remind us, "You will have to drag me out of here," as I shared earlier from Brittany. That is how you know the team loves what they get to do every single day. I remember sitting in board meetings discussing staff salaries with the North Star of the organization being able to support staff to live a dignified life. We knew that this would allow our staff to fully show up in their roles and be able to manage their personal needs. Welcoming a baby into the world is hard enough in the best possible circumstances, and having the security of your job and salary through one of the biggest life changes one can experience.
Time.
Thank you.
Thank you. Is Tanisha Long here? No. Hannah Standiford? On Zoom, do we have Maddie Stewart? Miss Lillian Miller on Zoom.
Hi, can you hear me okay?
Yes, thank you.
Hi, my name is Lillian Miller. I'm a nurse and first-time mom of a 10-month-old little girl. Before my daughter was even born, I was really disheartened to learn that as a nurse employed by UPMC, which is one of the largest employers in Allegheny County, I would only be receiving 2 weeks of fully paid parental leave. Beyond that, my leave would depend on short-term disability benefits and PTO that I had spent years accumulating. I'm one of the fortunate nurses when it comes to family planning. I was able to accrue significant PTO during the COVID lockdown, and I've not been burdened by any health complications. Furthermore, my husband and I have extensive support from grandparents and other family who are willing and able to help with childcare. Even with all those resources, the transition to parenthood is far more challenging than I ever anticipated. As nurses, we dedicate our careers to caring for others. We comfort families in their worst moments and celebrate with them in their best. And too often, that deep commitment to our patients is weaponized against us. We continue to show up despite staffing shortages, limited resources, and non-competitive benefits, because we know our patients need us and we genuinely care. Yet when it comes to the most significant events in our own life, like the birth of a child, we are often expected to fit our recovery, bonding, and adjustment into a rigid, transactional framework. It feels almost robotic, as though parenthood can be scheduled and managed like a staffing grid. The irony is that in healthcare, we understand that every person and family has unique needs. We would never treat our patients with a one-size-fits-all approach, and we know that healing and adjustment does not happen in a predetermined timeline. Every day, we're using evidence, compassion, and individualized care to help people through life-altering moments. Yet many working parents are expected to navigate their own life-altering milestones under policies that leave little room for humanity, flexibility, or recovery. That's not how we care for people, and it should not be how our employers care for us. The proposed amendment to provide 18 weeks of paid parental leave recognizes what parents, healthcare providers, and researchers already know. Those earlier weeks and months matter. Paid leave is not a luxury. It is an investment in the health and well-being of families. It provides time to establish breastfeeding, attend appointments, develop sleep routines, and create a secure bond that is critical for development. It allows families to focus on recovery and connection
30 seconds.
rather than financial pressure and return to work deadline. If becoming a parent was difficult, even with the support system that I am fortunate enough to have, I often think about the families who do not have those resources available to them. I think about the nurses, teachers, social workers, public servants, and countless others who spend their days serving this community, trying to manage with the first few months of a newborn's life. This amendment would ensure every parent in Allegheny County, regardless of their employer or personal circumstances, has the opportunity to care for and bond with their child during.
Thank you, Ms. Miller. The next three speakers in the room, Madeline Block, Laura Perkins, Yasmin Bennett, and online, Gloria Gonzalez Culverson. So Miss Madeline Block, is she in the room? No. Good. Laura Perkins. Thank you.
Hi there, Laura Perkins, born and raised in Pittsburgh, and I work for United Electrical Radio and Machine Workers of America. I myself do not ever plan to have kids. I really like cats. But I am here to ask you to support paid family leave. This need is going to help everyone. The United Nations actually recommends 24 weeks, so this doesn't even meet international standards, but it's a step in the right direction. Some studies that the UN report indicated was that paid family leave reduces employment attrition rates when effective family-friendly policies are in place, and that cited Google, which is the main employer in Pittsburgh. From personal experience, I can say that short-term disability is not a sufficient substitute for paid family leave. I myself had 5 weeks of short-term disability, and the first 2 weeks weren't even covered. I got $0 for the first 2 weeks, and then for the other 3 weeks, I only got, I forget if it was 60 or 70% of my salary. So when all was said and done, the short-term disability gave me less than half of my salary. So it's not even close to being a good substitute. Yeah, that's it. Please support paid family leave.
Thank you, Ms. Perkins. Yasmin Bennett. Welcome.
Thank you. Good afternoon. My name is Yasmin Bennett Kelly, and I'm the Director of Strategic Initiatives at Healthy Start, Inc., a maternal and child health organization committed to improving outcomes for mothers, babies, and families. In my role, I work every day to advance policies and programs that help families thrive. However, today I'm speaking not only as a public health professional, but also as a mother in this county. Paid parental leave is often framed as a workplace benefit. I see it as something much more, a public health investment that strengthens families and communities. As a new mother, I was fortunate to have some resources, some support, and some access to care. I also experienced some postpartum anxiety. My thoughts were constantly racing. Am I feeding her enough? Is my breast milk enough? Is she safe? Why won't she stop crying? Am I doing this right? I was recovering physically, adjusting emotionally, attending appointments, learning my baby's needs, and trying to be the best mother that I could be. The earlier months of parenting are filled with questions, uncertainty, and responsibility. Parents are focused on bonding with their babies, supporting healthy development, and navigating one of the biggest transitions of their lives. They should not also have to worry about how they will pay their bills, whether they can afford another week at home, or whether they must return to work before they are ready simply because they have no other choice. We all deserve a thriving and healthy community, and that starts with supporting families from the very first day. Paid parental leave gives parents the time and stability that they need to recover, bond with their children, establish breastfeeding if they desire to, and seek support for their physical and mental health. No parent should have to choose between caring for their newborn and keeping a roof over their head. By supporting paid parental leave, Allegheny County has an opportunity to invest in the health, well-being, and the future of its families. Thank you for your time.
Thank you.
Thank you. Do we have Gloria Gonzalez Culverson on Zoom? Thank you. Welcome.
Hi. My name is Gloria Culverson, and I am a maternal health advocate. I wear many leadership hats in the community, and I'm a small business owner with an even smaller staff. And I support the goal of improving maternal and infant health outcomes and creating a society where families are better supported. Because I do believe that parents should have meaningful opportunities to bond with and care for their children. With that being said, as I reviewed this proposal, I found myself with several questions about implementation and long-term sustainability. And today I'm just bringing up 3 top priority questions. So my first question concerns the eligibility threshold. The proposal appears to make employees eligible after 30 days. And I wanted to know what analysis led to selecting 30 days as the appropriate threshold, and what considerations was given to the impact on small employers who may be required to provide up to 18 weeks of paid leave after a relatively short employment relationship. My second question concerns how this proposal interacts with existing employer leave policies. The language appears to require paid parental leave and paid sick leave to be accrued and calculated separately from other paid leave benefits. And I wanted to see if you can clarify how employers that already provide paid time off or parental benefits would comply with these requirements and what additional administration burdens were considered. And I do want to say again that I believe in family support, but I think adding these overlapping mandates both in parental leave and sick leave could potentially push an unsustainable burden onto small employers. So I guess my final question is, was there any impact analysis done for small businesses, and are there any alternative scaling options so that these requirements don't cripple the very businesses that support these communities? Thank you for your time and the opportunity to provide feedback.
Thank you so much, Ms. Culverson. Okay, we'll move on to the next 3 in-person speakers: Passion Currington, Eric Schmidt, and Rebecca Ratcliffe in person. And if we have Mr. Justin Johnson online, we'll come back. So Passion Currington.
Okay.
Welcome.
Hello, Passion Currington, and I am a mother, a grandmother, and a community health advocate for Healthy Start. I believe paid paternal leave is not a luxury. It's a necessity for healthy families and healthy communities. Bringing a child into the world is a major life transition, and no mother should have to choose between caring for her newborn and paying her bills. Paid paternal leave helps eliminate a lot of the stress that comes with starting or growing a family. When mothers have time to recover physically, emotionally, and bond with their babies and adjust in parenthood without financial fear, the outcomes are better for everyone involved. Paid leave can also play a role in reducing domestic violence, financial dependence, and emotional stress, are major factors that can keep people trapped in unsafe situations. Giving mothers and fathers financial security and time to stabilize after childbirth can provide protection, support, and options at a vulnerable time. Supporting paid paternal leave means supporting children, supporting women, and supporting families. Strong families create stronger communities, and every parent deserves the opportunity to care for their child without fear of financial hardship. Thank you.
Thank you. Eric Schmidt. Welcome.
Hello, thank you for the opportunity. As you said, my name is Eric Schmidt, and I am the chairperson of the Allegheny County EMS Chiefs Association. This is a position statement from the Allegheny County EMS Council, which represents the 32 ambulance services that provide emergency services to the 130 communities in Allegheny County. So, we see a wide diversity of patients we treat in EMS, and from the best of days to the worst of days, one of the absolute best is when we bring a new life into the world. It's a highlight of many people's careers, and it's something we look forward to as care providers, a very positive thing we do. That being said, Allegheny County EMS providers support families. We support parents. We support time to bond with a new child. But this proposed regulation poses a serious challenge for an EMS system already operating on the edge. A Of the 32 EMS agencies serving Allegheny County, only 2 are tax-based supported. The remaining 30 agencies survive primarily on insurance reimbursement, subscriptions, donations, and fundraising, all responding to increasing call volumes, staffing shortages, and rising operational and capital costs. This proposal will require up to 18 weeks of paid parental leave while also maintaining benefits and job protection. For EMS agencies that must staff ambulances 24/7, the impact goes far beyond simply paying an employee on leave. Every open shift must still be filled. That means overtime, burnout, and additional strain on an already exhausted workforce. Another aspect requires coverage for both spouses, domestic partners, even if they are employed by the same company, a scenario that is not uncommon in the EMS community and doubles the challenge. Unlike many large corporations, EMS agencies cannot simply absorb these costs or leave positions vacant. If an ambulance is not staffed, communities wait longer for emergency care. EMS in Allegheny County is already in crisis. Agencies continue to close, merge, or reduce services because the EMS funding model has been broken for years. When my career started, there were over 140 EMS agencies in Allegheny County. Adding major unfunded mandates without addressing the financial realities of emergency medical services risks pushing more providers closer to collapse. If Allegheny County truly values EMS, then any discussion about expanded employee benefits must also include sustainable EMS funding. We cannot continue to demand more from emergency service while providing no realistic mechanism to support the cost. Our communities deserve both strong family leave protections and a stable emergency medical system. Right now, this proposal threatens the ability of many EMS agencies to continue providing the level of care and service our residents depend on every day. Thank you.
Thank you. Thank you, Chief Smith. Rebecca Radcliffe. Okay. Is Justin Johnson online? Okay, thank you. The next 3, Matt Naper, Brooke Berry, and Sadaf Tayefi. And online, Tyler Meyer. Matt Naper.
Good afternoon. My name is Matt Napper, Board Chair, and I'm speaking on behalf of the Northside North Shore Chamber of Commerce, which represents more than 450 businesses, nonprofits, sole proprietors, and community organizations throughout Pittsburgh's North Side and surrounding neighborhoods. Let me begin by saying that the Chamber supports paid parental leave as a concept. We recognize its importance of allowing parents to time the bond with their child for care and to care for a new child. The issue before us today is not whether paid parental leave has value. The issue is who should bear the cost. The proposed mandate would place an entire financial burden on employers regardless of their size, financial condition, or ability to absorb the expense. For large corporations with extensive resources, that may be manageable. For small businesses and nonprofits that make up a majority of our membership, it is not. Consider a neighborhood pizza shop with an annual revenue of $500,000 and a profit margin of just 10%. If one full-time employee takes a full 18 weeks paid leave, the combined cost of continuing the employee's paid benefits while also hiring replacement coverage could exceed $50,000. That single leave event could wipe out a business's entire annual profit and push it into a loss. Many small employers are already facing rising labor costs, inflation, increased insurance expenses, and economic uncertainty. They do not have the dedicated HR departments or large cash revenues. They operate month to month, balancing payroll, rent, utilities, and inventory. An unfunded mandate of this magnitude could force difficult choices, delaying hiring, reducing hours, postponing investments, or in some cases, closing altogether. The consequences extend beyond the individual business. When costs rise dramatically, employers become more cautious about expanding. Some may choose to locate future options outside of Allegheny County where regulatory burdens are lower. Nonprofits already struggling with funding pressures may have to redirect resources away from the community programs and services that residents depend upon. If paid parental leave is a public good, and many of us believe it is, then the cost should be shared broadly through a public funding mechanism, such as a county or state-administered program, rather than being imposed entirely on the individual employers, especially small businesses that lack the resources to absorb these costs. The Chamber respectfully asks the Board of Health to reject the proposal and instead work towards a solution to support families without jeopardizing small businesses and nonprofits that are the foundation of our local community. Thank you.
Thank you. Brooke Berry. Sadaf Taif. All right, I'm going to give an opportunity one more time for the people that I've called before I actually mark them off the list so we can move on. Jeff Schroeffel. Adrian Andrews. Tim Garner. Tanisha Long. Welcome.
Thank you for recalling me. I appreciate that. I come here today as a childless Allegheny County resident, childless by choice. One of the things that have factored into that choice is cost. Growing up, I saw my mother struggle to work 3 jobs. She has 7 kids, and she returned to work shortly after birth with each of her children because we could not afford to be a growing family that did not have income coming in. I saw the stress and strain and burden it put on her, and I realized that that was something that, not only was I unwilling to take on, but I couldn't afford to take on. We live in a world that pushes women to have children. We live in a world that pushes families to expand. We live in a world that, has put it upon us that we are supposed to create the next generation. But right now, we live in a world that does not give us the resources to take care of that next generation. And what we see and what we have before us is an ambitious plan to make sure that we're able to provide for our families and that we're able to grow and expand in the way we envisioned and in ways that don't cause harm. I hear a lot from the business owners who are overusing this word burden and cost. And I hold the strong belief that if you are someone who is looking to start a business in this county or looking to start a business in this country, then taking care of your employees should be factored into that cost. They are not an exhaustible resource. They are not disposable. And when you view families in that way, you set the tone for how the country views women, how the country views parents, how the country views fathers who want to be take an active role in their family's life and creation. And that's not a business I would want to shop at. We see what happens when consumers start shopping value-based. We saw that with the Target boycott. We've seen that with BDS boycotts. We don't want to shop at places that don't support us. And I don't want to be involved in growing a business that would not want me to grow my family in a way that is safe, healthy, and financially realistic. I applaud the county's efforts to make this a reality. I don't think it's too ambitious. I think that right now we have the opportunity to follow in the footsteps of 14 other states, but do so in a way that actually provides a financial safety net where people can recover and build those bonds with their families. I see PPS closing. I see schools closing. I see after-school programs disappearing. I see kids being banned from public spaces. We are not just unfriendly towards parents and children. We are openly hostile towards families. So I applaud the county's efforts to do that. I support this plan, and I hope that we can support paid leave. Thank you. Thank you.
Thank you, Ms. Long. Do we have Hannah Standiford? Madeline Block? Rebecca Ratcliffe? Yes, I saw her. Amanda Denham online? Maddie Stewart on Zoom? All right. Brooke Berry? Sadaf Taifi?
There's Brooke.
Oh, welcome.
Good evening. I come here tonight as a community health advocate with Healthy Start. I come here as a mother, and I come here as a child care provider. Paid parental leave is absolutely necessary for families, not only in the county, in our society. If we want the next generation of children to be successful, then parents need paid parental leave. As as a through my child care provider lens, 95% of the brain is developed under the age of 5. If we don't give parents paid parental leave and they have to struggle and dismantle their support systems to try to find care, to rush back to work, we are going to pay for it later with the children and as they grow into adults. So I firmly believe in paid parental leave because it benefits the entire society, just as several women came before me tonight and expressed that they do not have children, they do not plan to have children, but yet they absolutely see the necessity of having paid parental leave, because to function as a society, we have to value community and we have to value families and children. And right now, we do not value them. Thank you.
Thank you. The next 3 speakers, we have Marshall Del Rosario, Aiden Halpern, and John and Suzanne Graff in person, and Brandy Anderson Cherry online. Marshall Del Rosario?
That's me.
Yes.
Yes.
Welcome.
My name is Marshall, and it cost me $150 to be here tonight. Thus, I agree with Dr. Van, who said in the May 13 press release that not enough people in Allegheny County have adequate access to paid leave. But when I say paid leave, I don't mean parental paid leave. I mean paid leave for everyone, not just those irresponsible enough to reproduce without the financial means. This policy is, quote, designed to strengthen the future economic stability of our communities. PBS reported on April 10th that the domestic fertility rate is down 23% since 2007, meaning the replacement rate is not being met. This policy is good for the economy because it will replenish the rich with a generation of low-income workers to keep this scheme going. Let me be clear, 18 weeks of paid leave does nothing for a lifetime of poverty. And when I say lifetime, I mean it because the minimum wage here in Allegheny County has been $7.25 since before I had the ability to remember, let alone read, write, or understand that employers do whatever it takes to pay as little as possible. I'm sure Dr. Van can tell us the difference between treating a symptom and treating a disease. Mandating paid parental leave is a Paw Patrol Band-Aid on a sore caused by the black plague of unaffordability. If this policy is done with genuine intention and you want to see preventative health in action, how about wield your power to use Allegheny County as a testing ground for modes of universal health care? How about leveraging research at Pitt so that the burden and cost of birth control can be shifted off of women? How about paid marital leave to mitigate single-parent households? Right now, as this policy stands, it's creating a rift between the working class, so we won't call on you to do something to help everyone, not just the people who like to ejaculate or be ejaculated in without protection. This is a literal payment for the creation of more poor people, which nobody wants to admit that they want. And I also want to say that a lot of people in here need to stop acting like having a kid isn't a choice. But anyways, in a region with 3 rivers, you think it'd be obvious that a true rising tide will lift all boats, not just those who want to have more kids. Thank you.
Thank you. Aiden Halpern, welcome.
Thank you. Thank you. Good evening. My name is Aiden Halpern. I'm speaking on my own behalf today. I've lived in Pittsburgh since 2017 and would like to build an Allegheny County that I can afford to stay in and perhaps even raise a family in. That's why today I'm voicing my strong support for this board's measure to guarantee 18 weeks paid parental leave for all county residents. As someone in my late 20s, so many of my friends and neighbors simply cannot imagine having kids in this economy. Whether it's rent, food, health insurance, or $4.85 a gallon gas, we are barely scraping by. Tack on the cost of daycare, food, and diapers, having children requires us to make impossible choices. As a working person, you essentially have two options. One is you work 2, 3, 4 jobs, laboring long hours that take a toll on your body, and coming home too exhausted to provide the kind of parental attention that kids need. The other option is staying at home and having to make painful trade-offs between food and medicine, decisions that no parent should have to make. The fact that this is a reality is a policy catastrophe. The United States is one of only 7 countries that does not guarantee some form of paid parental leave to its residents. Pennsylvania is not among the states that mandate paid parental leave, as we all know. Instead of waiting for changes in state and federal policy, we can act now as a county to pass this measure and improve the health and well-being of hundreds of thousands of families. And let me emphasize that this only works if everyone benefits. Whether they're working at UPMC or a mom and pop shop, every worker deserves the option to receive up to 18 weeks of paid parental leave. Small business employees also have kids. They must be included in this mandate. And while mothers and people who can get pregnant, of course, face unique challenges, it is critical that paid leave be available to all parents. How can fathers be a part of their lives, of the lives of their children and share child care duties if mothers are the only ones who can take leave? Fathers, mothers, all parents must be able to spend time with their newborns. I want to end on this note. I believe that my generation will be fantastic parents if we're given the opportunity. We'll understand the world that we're bringing our children into because it's our world. We'll cherish our queer, trans, and disabled children in a way that, sadly, our parents didn't always do. But with universal parental leave, we will have the opportunity to raise the most diverse generation in Allegheny County history with the care and attention that our kids deserve. Thank you.
Thank you. John and Suzanne Graff. Mr. Graff?
Hi. Obviously, Suzanne's not here, and she'd probably be mad her name was in there. But anyway, my name's John Graff. I'm a resident of Ben Avon, and I'm also a business owner here in the city of Pittsburgh. I'm here today to urge the Board of Health to vote against this amendment to the health code. I agree with the concept of paid parental leave. I think it makes sense, and I think it makes sense for the businesses that can afford it and are not put at threat of going out of business because they are providing it on a mandatory basis. It's a public good. The county needs to figure out a way to have the public at large pay for it, not put it on the backs of small and medium business size owners in the city, which will, as one of our other speakers alluded to, will cause people to locate outside the county or just not come here at all. For small businesses, for local shops, the restaurants, the places you like to go on your main streets, this isn't a public health problem, it's a math problem. And the math simply does not add up. For many of these small businesses are eking by on very, very small margins. And when you go and you introduce what's in essence a tax onto those businesses that could be equal to the amount of their yearly profit or more, that is that they're going and borrowing money to keep this up when somebody invokes the paid parental leave, that's a problem. You're going to put people out of business because at some point, it's a lot easier to go work for the DMV than it is to go and run your pizza shop. It just is. People are going to be, they're going to be very tired. They're not going to be able to pay it, and they're going to say it's easier just to hang up the spurs. And to give you an idea of just how ridiculous some of the amendments to this code are, somebody could right now walk into, let's say we have a bakery on Main Street here in Allegheny County, could walk in, it's a domestic partner of somebody, and they work there for 31 days, and they say, oh, you know what, I'm invoking my parental leave because my wife's having a baby. So that person then takes the 18 weeks of leave, he's only worked 30, keep in mind, gets paid the full amount of benefits, the bakery has to hire somebody to go replace that person, likely at a premium because that person knows that they're only going to be working temporarily, and pay benefits for both of those people. That's it. I mean, it's game over for a lot of people. So I urge the Board of Health to vote against this. And if you need to go and make changes to it to make it universal in terms of the coverage of who's paying for it, fine. Thank you.
Thank you.
Do we have Brandy Anderson-Cherry online? Okay, thank you. Yes, County Executive Sierra Namarato. Welcome.
Thank you. And good evening. I'm honored to be here tonight to give some public remarks to support paid parental leave across Allegheny County. So we all heard from the Board of Health meeting a few weeks ago about the unimpeachable evidence that paid parental leave is a necessary public health measure. Babies need time in a safe environment to adjust, to be taken to doctor's appointments, to get vaccines before they're put in communal daycares, and time to bond with their new parents, especially if mom is breastfeeding. Adopted parents and legal guardians also need time to bond and establish a new family, and that is regardless of gender. And of course, especially moms who just gave birth, either vaginally or via C-section, need time at home to recover without the added stress of losing income. So I'm not going to restate all the public health facts in my remarks. I'm going to leave that up to the public health professionals and the medical professionals. But I do want to address in my remarks what happens if we don't have paid parental leave. First of all, we lose women in the workforce. According to Parental, who offers paid parental leave insurance, 40% of women with no paid leave quit their jobs after a year of giving birth. The Institute of Women's Policy and Research found that paid parental leave cut the number of women who left the workforce by 50% in the first 5 years after birth. Meanwhile, KPMG reports that of full-time workers who needed to cut their hours to part-time due to childcare programs, 66% were women and 34% are men. We also lose daycare slots that we desperately need for older kids because infant slots require so much staffing and are so expensive. We also lose precious time that can never be replaced as a family. The United States is the only wealthy country in the world that doesn't guarantee maternity leave. I was in Ireland last week celebrating our direct flight between Pittsburgh and Dublin, and I was at dinner with an Irish delegation. I was talking to a woman at one of the major corporations over there, and I was explaining to her that we don't actually offer guaranteed paid parental leave. And she remarked, "That's barbaric. It's barbaric." This is the way that the world views us as the United States. And I know that I am tired of waiting for a federal action that never seems to come. I supported paid parental and family leave when I was in the state legislature, and I'm proud that the House has passed a paid parental leave, paid family leave bill this past year with bipartisan support. But I do not see a state Senate taking action despite a thoughtful bill crafted by Senator Piscitano and Capoletti, and I'm tired of waiting for state action. I hear the concerns of businesses. I know many business leaders in Allegheny County support this work philosophically, and those are businesses of all sizes, and that the cost shouldn't be passed on to employers, and that we need a better public safety net. I hear you. I'm open to feedback, and we have gone above and beyond in my administration to take concerns of businesses seriously. I just want to go through a couple points. In my administration, we've invested more than $15 million into growing businesses of all sizes and creating jobs. We've cut red tape for permits, we've opened a new airport and hosted CEOs to hear what else we can do to create a competitive environment here. We've sidelined other priorities to get $1 billion in investment here in the Golden Triangle. We are committed to growth through and through. But every request for a sector or a business to be exempt from a paid parental leave law, for certain employees not to be covered, for less coverage, for stricter eligibility, is a request to leave some families high and dry. In Allegheny County, we are tired of waiting for solutions. We need help, and we need it now. I have worked so many jobs before I got here as county executive at places where margins are tight. I've been a tipped worker, an hourly worker, a nonprofit employee. I've worked for small businesses. I have worked for myself. I know that there are no easy solutions for businesses. In a county where only approximately 42% of people who give birth have access to paid leave, that means a lot of employers have figured out the way to make this work. And it means a lot of women, babies, and families are still left to scramble. I believe that we can and we must do better. 14 other states have mandated paid parental leave in some form, and there are years and sometimes decades of data for these cases. There's no evidence that businesses run for the border or relocate when met with this mandate. I will tell you, for the businesses who are curious in offering paid parental leave, a cost calculator is available now at AlleghenyPPL.com to estimate what paid parental leave insurance would cost your specific business if you want to get a fact-based assessment. Recently, I launched Forward with Families to make Allegheny County a place that is more attractive for families to move here and to stay here and to grow here. Businesses offering benefits that reflect the reality of what families need to be successful in this economy is part of that equation. We cannot grow if families cannot afford to live here. Legacy businesses in finance and material sciences have already proved it. Emerging sectors like tech and clean energy understand that to be competitive, they absolutely have to offer benefits like generous paid family leave. And if we're competing with top-tier markets for those workers, we cannot be in the dark ages when it comes to how we treat our talent. In so many ways, this is a crazy and terrifying time to start a family. And there are a million reasons not to do it. But as Americans, we're historically optimistic. Our immigrant ancestors took risks and made incredible journeys to get here because they believed that better things were possible for them and for the next generation. It's like the poll that found that some Americans think that they can actually beat a lion in a fight. Maybe it's just delusion or it's optimism. It's our DNA that keeps people wanting to have babies despite all the ways the world and sometimes our own biology makes it so hard. And we could take this step in Allegheny County to make it just a little bit easier for families. And maybe we'll knock over a few dominoes across the state and shake the state to take some action too. So thank you to the Health Department for recognizing me to speak. Thank you for everyone who came out tonight to voice your thoughts about paid parental leave. I'm an optimist. I'm also tired of waiting. Thank you.
Thank you, County Executive.
Wonderful thing to say in a utopian society, but the reality is...
Excuse me.
We're sorry. No, we're not doing
this.
We're not doing this right now. I'm sorry.
Please have a seat, or we will get somebody to get you out of here.
Sir, please sit down. Thank you. We're moving on to the next three speakers. Please, Joshua Malloy, Tyler Gillett, and Kevin Whalen. And online, if we have Mia Haney. So we'll move on with Joshua Malloy. Welcome.
What's up, everybody? How you doing? I just want to thank all the parents, expecting parents, new parents who came out to support this work. I just spent the last 2 days in Harrisburg with PA United advocating for the working class all over Western Pennsylvania, all over Pennsylvania, really. And we spent maybe 4 hours in the state capitol, and every legislator I would go and talk to, I would come across like the same set of 4 white dudes. Yeah. So eventually I had to ask them, yo, who you guys with? I thought they may have been up there with the nurse practitioners who were organizing around something. I don't know. But eventually, you know, they told me, oh yeah, we are with a lobby group representing banks and businesses, basically. And I am tired of all of the access that businesses get to all our lawmakers. I'm tired of the working class being sacrificed at the altar of capitalism. And it hurts me to see when we're talking about a policy that is going to benefit thousands of people in Allegheny County, new parents, especially when I'm a millennial. A lot of millennials are giving up on the dream of building a family because it's too expensive. Right. I'm tired of hearing from the business class. I'm tired of hearing from the capitalists. I hope all of you guys go home before you get a chance to speak. But I'm here. I'm here for the nurses. I'm here for the workers. I'm here for the people advocating for themselves and their families. And I guess that's all I got to say.
Thank you. Tyler Gillett? Am I saying that? Gillett. Thank you.
Yes, my name is Tyler Gillett, and I'm a staff attorney for the Women's Law Project. For more than 50 years, Women's Law Project has worked to defend and advance the right of women, girls, and LGBTQ people across the Commonwealth, and we strongly support the passage of paid parental leave in Allegheny County. Our mission is informed by the principles of reproductive justice, a concept created and developed by Black feminist organizers. Reproductive justice, as defined by Sister Song, is the right to bodily autonomy, to have children, to not have children, and to parent the children we have in safe and sustainable communities. And paid parental leave is a reproductive justice issue. The Pennsylvania Supreme Court has called pregnancy one of the most consequential decisions a person can make and has recognized the right to procreation as fundamental. But people have to be able to afford to have children. A majority of workers in Allegheny County lack any sort of paid parental leave, and even those workers who have access to paid leave lack an adequate amount of leave. If the county has a compelling interest in growing its population, it needs to provide access to time off with a guaranteed income, so new parents don't have to worry about bills while they are focused on a new child. The wealthy have always had access to enough time to recover and to bond with their children. Workers deserve the same opportunity. The current system is untenable. Most workers are forced into taking unpaid leave for however long they are able to afford and must return to work sooner than they should. Too many workers have to choose between careers and families, but access to paid leave will allow them to choose both. Paid leave will strengthen our communities and enable families in Allegheny County to grow in a sustainable fashion. Reproductive justice demands we extend paid parental leave to as many workers as we can. For too long, workers have been left behind, and now is the time to lend them a hand to catch up. Thank you.
Thank you. Kevin Whalen? No. Is Mia Haney on Zoom available? Thank you. Our next 3 speakers, Katie Melson, Daniel Clements, and Kenisha Deshawn, and online, Christina Ricketts. Katie Melson, welcome.
Thank you. My name's Katie Melson. I am a resident of Pittsburgh. I'm a registered nurse and a union organizer. I'm the wife of an amazing woman who also adamantly supports this proposal but couldn't be here this evening. And I'm the mother of two pretty badass young adults that were new babies what seems like minutes ago. In reality, nearly 21 years ago in rural Virginia, I gave birth to my son. My only option at that time for parental leave was to take 12 weeks of FMLA unpaid, except for the vacation and burn through the vacation and sick time that I had, leaving me no cushion when I returned to work. I chose not to return to work after my daughter was born, in large part because it was ultimately financially infeasible to work full-time with 2 children in childcare, but that is for another night. As a union organizer, I watch every day as nurses and nurse practitioners are told over and over again that there is no money for paid parental leave while watching billion-dollar healthcare systems like AHN and UPMC spend money on everything except the people who make those systems run. Paid parental leave isn't radical, it's overdue. At present, AHN provides 0 weeks of paid parental leave for nurses at AGH. I have had to explain to no less than 4 women this year that their employer has made the conscious decision to refuse to agree to provide any form of paid leave and that they cannot, sadly, enroll in employee-paid short-term disability after finding out that they are pregnant. Elsewhere at AHN, 3 weeks is the most amount of paid parental leave offered to any nurse. And at UPMC, nurses are offered a measly 2 weeks that must be paid back if a worker leaves their position within 1 year of utilizing this so-called benefit. Let's call it what it is. It's a choice. These organizations generate billions in revenue every year and pay no taxes. They build new facilities, expand services, acquire practices, launch advertising campaigns, and pay executives tens of millions of dollars. Somehow there's always money for those priorities, money that is made off of the backs of nearly 100,000 workers in this county. When workers ask for paid time to recover from childbirth, they're suddenly told it's too expensive, and no one should believe that. Nurses spend their careers caring for everyone else's families, working nights, weekends, holidays, through staffing crises, and they care for all of us in this county on what is often the worst day of our lives, and they're forced to burn through PTO, go without a paycheck, return to work before they are physically recovered. Nurses have heard enough excuses. I wholeheartedly support this proposal and would be very proud to live in a place where families are valued.
Thank you. Mr. Clements?
Thank you for your time. I wanted to come today just to kind of explain some of the issues with this policy and how it is going to, impact small business. So just right off the bat, this kicks in after 30 days. It can be taken within 12 months of birth, and you get 18 weeks of fully paid leave. So a few questions I have is, how does this interact with FMLA, for example? So if I'm an employee, I work in the private sector, work for a company that has 50 or more employees, I could take 12 weeks of FMLA protected leave, and then at the end of the 12 weeks, I could say, oh, by the way, can I now take my 18 weeks of paid leave? That's 30 weeks of leave. I don't know. That would be like if I took that now, I'd be back in 2027. I don't know how a lot of these businesses are going to be able to factor that in. They would obviously have to staff for that. Many employers are going to need to backfill these jobs, which of course is going to increase costs. It's probably going to increase 1099 employees. There's going to be burnout. There's going to be resentment from some employees who can't have kids or don't want to have kids or too old to have kids. Comparisons are being made to the Paid Sick Days Act, but that's an accrual-based act where you have to work and actually accrue your time. This right at 30 days, most employees are not off of orientation. They're not off of their provisional employment period. And then right off the bat, it's an immediate, 18-week, expense for employers. So What I would say is not every business is evil, not every business is malicious, not every business is a multi-billion-dollar corporation. I work for a nonprofit. We do a lot of, things with hospital, daycare. This would be incredibly burdensome. If this does pass, I think preemptive layoffs could occur. Businesses will relocate to other counties. Staffing will be cut, and other benefits like salary increases and benefits are going to increase even more. Right? I guess the salaries would stagnate and benefits would increase. So I do support the growth of families. I'm a big supporter of that. I just think it's wrong to hold employers hostage in this process. So thank you for your time.
Thank you. Ms. Keisha Deshawn.
Good evening. My name is Kiasha Deshawn. I am a mother, a passionate community member, a small business owner, and a birth doula serving expectant families throughout Allegheny County. Over the years, I have had the privilege of supporting families during some of the most important and fragile moments of their lives, welcoming a new baby, recovering from childbirth, adjusting to parenthood, and learning how to balance work and family responsibilities. And what I have seen time and time again over my 20-plus year career is parents bonding with a new child coming at the expense of a family's financial stability. No parent should have to choose between healing after childbirth and paying their bills. No parent should have to return to work before they are physically, emotionally, or mentally ready because they can't afford the unpaid time off. And no child should miss out on those critical early weeks of bonding because their family has no other option. As a small business owner, I understand the importance of a strong workforce, but as a birth professional, I understand the importance of healthy families. And as a mother, I understand how quickly those early moments pass and how deeply they matter. Paid parental leave is not just an employee benefit, it is an investment in healthier families, healthier children, and ultimately a stronger community. It helps parents recover, it supports infant development, and it improves workforce retention. And it also demonstrates that we value the people who do the essential work of raising the next generation. The support of paid parental leave in Allegheny County will send a clear message that families deserve the time, the dignity, and the financial security they need to welcome a child without the fear of economic hardship. Thank you so much for your time.
Thank you. Before we move on to the next set of speakers, I just want to make sure that I give one more opportunity for a couple of speakers that were on Zoom. Justin Johnson, Tyler Meyer, Brandy Anderson Cherry, and in person, Kevin Whalen. The next set of speakers, Lucy Rose Ruscio, Melissa DeCass, and Beth Rupert, as well as Jessica DiStefano on Zoom.
We skipped over Christina on Zoom.
Excuse me?
So we skipped over Christina on Zoom.
Oh, Christina Ricketts. I'm sorry. Yes. Do we have Miss Ricketts online? Okay, we'll come right back to her. Thank you. All right. Miss Lucy Rose Ruscio.
Yes, hi.
Welcome.
Thank you. Thank you to the Allegheny Board of Health for this opportunity for me to support to give my strong support for paid leave for all working parents. Like I said, I'm Lucy Rose. I'm a nurse practitioner in the neonatal intensive care unit at McGee Women's Hospital. I'm a mother of 2 young sons and soon to be a girl mom as well. I'm also an active member of our state's largest healthcare union, SEIU Healthcare PA at McGee. As a bedside NICU nurse, I've witnessed countless parents struggle to balance the joy of childbirth, the anguish of a NICU admission, and the profound dread of the timeline to go back to work. Mothers who wanted to breastfeed, who needed to heal and spend time with their children, but who knew that often in as little as 2 weeks' time, their cracked, bleeding bodies would be pulled back into an office miles away. Dads who missed out on swaddling lessons and milestones that don't come around a second time because the economic reality was that their family could not go without another paycheck. And this is not just for poor families. These struggles were reflected in our recent community survey that we performed with over 1,000 responses. People shared their really deeply personal stories like they have today. It just shows how not controversial this is and where there may need to be tweaks to make this doable. We cannot leave our county at the bottom of the barrel. We have to raise the minimum. We've spoken a lot about who can't afford this, and I think we need to talk about who can afford this as well. As I said, I work for UPMC, the largest healthcare employer, the largest employer, private employer in the county and Commonwealth. They made, I believe it was $621 million in the last quarter alone. I have dedicated my life to taking care of infants and their families. I get 2 weeks paid parental leave from my employer. We see these struggles across the county. Parental leave is the urgent antidote to the maternal and infant health crises in our communities. Study after study proves that paid parental leave reduces infant and maternal deaths, improves breastfeeding rates, and improves the physical and mental health of both parents and children. This is an economic issue as well.
30 seconds.
We're all suffering from the rising cost of simply existing these days, and working parents shouldn't have to worry about losing their paychecks or even their jobs in order to take care of their babies. So thank you, and I support this bill.
Thank you. Melissa DeCast. Welcome.
Thank you. Hi, my name is Melissa DeCast, and I want to share my brief remarks from my perspective as a midwife at McGee Women's Hospital. I take care of families during pregnancy, labor, birth, and the postpartum period. And one of the more frustrating things I see in my job, and I see it relatively frequently, is being asked by my patients to write return to work letters much earlier than sometimes I even feel comfortable with, sometimes as early as 2 weeks postpartum, because they don't have the benefit and security of paid parental leave. But oddly, they're being asked for a letter also from their employer that they can return. At 2 to 4 weeks postpartum, people are still recovering from birth, and there can be significant consequences to maternal mental health, breastfeeding success, parent-infant bonding, and other health consequences, ranging from pelvic floor issues to cardiovascular health. And when families run into complications, whether it's severe postpartum depression and anxiety or blood pressure issues, it can be like pulling teeth to be able to extend their short-term disability if they even have that. This proposed addendum to the paid sick and parental leave article will make a huge impact on the health of our community and should be viewed as a serious and vital piece of legislation to contribute to the health of families and their babies in our community. And it's a tool to combat also the racial disparities in maternal and infant morbidity and mortality that we see specifically in our area. Parental leave should be viewed as a critical public health issue and not just a nice benefit that some people get to have. That's all. Thank you.
Thank you. Ms. Beth Rupert, welcome.
Hi, thank you. Good evening. and thank you for the opportunity to speak today. My name is Beth Rupert, and I am the owner of Solid Foundations Academy, providing children with child care in locations in Wexford and Hampton. I also live in Allegheny County. Over the years, we have served thousands of families, supporting children's development while helping parents remain active participants in the workforce. Let me begin by saying I support parental leave. Parents deserve meaningful time to bond with their newborns, recover from childbirth, and adjust to the responsibilities of caring for a new child. There are important goals that strengthen families and communities. However, while the intention behind extending parental leave is admirable, I believe that this proposal that you have right now could create significant unintended consequences for the child care industry, small businesses, working families, and the broader economy, and harm the children that you are going to support. Child care is not simply a service for families. It is essential workforce infrastructure. Every day, healthcare workers, teachers, first responders, manufacturers, retail employees, and small business owners rely on child care in order to work. When child care capacity decreases, the effects are felt throughout every sector of the community. The child care industry is already operating on razor-thin margins. Providers continue to face rising labor costs, insurance premiums, facility expenses, and regulatory requirements. An 18-week leave mandate would delay enrollment for many families, creating revenue gaps for providers that depend on consistent enrollment to remain financially viable. As centers struggle to absorb these costs, child care costs may increase, placing an even greater burden on Allegheny County families. Child care providers would also face unique workforce challenges. If an employee takes extended leave, centers must maintain required staffing ratios while recruiting, hiring, and training temporary replacements. Providers would be responsible for paying for both the employer on leave and their replacement, creating financial pressures that many centers just simply cannot absorb. If the replacement cannot be found, which is likely because we are struggling to find employees as it is, the health, safety, and welfare of children are at risk. We support this, but please make amendments to help the child care sector to be able to provide this for children and families. Thank you.
Thank you. On Zoom, we have Christina Ricketts. Ms. Ricketts, can you hear us?
Yes, can you hear me?
Yes, welcome.
Thank you. My name is Christina Ricketts, and I'm here today both as a mother of three and an HR professional with over 14 years of experience. I spent much of my career in employee relations, including working for global organizations where paid parental leave is not just encouraged, but expected and required. I've seen firsthand how policies like this support families, strengthen workplaces, and improve retention. On a personal level, I have had 3 children in the last few years, in 2022, 2024, and most recently in November of 2025. I was fortunate by the last 2 employers to receive a combination of paid and unpaid leave between 18 to 20 weeks each time. Even with that support, returning to work as a new mother was and is still incredibly challenging. At 6 months postpartum currently, I am still exhausted. My Mother's Day gift was an espresso machine. Oh. My baby is only just beginning to sleep longer stretches at 6 months. I can't even imagine being forced back to work earlier than what I returned postpartum and being expected to perform at full capacity. But many parents don't have a choice. From a professional standpoint, the reality is this. Under FMLA, employees must work at least 1 year and 1,250 hours just to qualify for up to 12 weeks of unpaid job-protected leave. And that protection doesn't even apply to everyone. True story, earlier in my career, I had to call a new mother who didn't qualify for FMLA. She had just only worked 3 months. The only leave available for her was 2 weeks of personal leave. I had to call her a week and a half after she gave birth and tell her that she had to either return to work after the 2 weeks is up or she would have to resign. Guess what? She returned to work 2 weeks postpartum. That newborn went without its mother, and that mother had to separate from her new baby. I still think about her till this day. That was not an isolated situation. The United States is one of the only handful of countries in the world that does not mandate paid maternity leave. While some states have taken action, Pennsylvania is not one of them. Families here are left without consistent, reliable support during one of the most critical times of their lives. This isn't a policy issue, it's a human issue.
30 seconds.
Paid parental leave allows parents to recover, to bond with their newborns, and to return to work healthier, more focused, and more committed. It supports not only families, but also businesses and communities. If paid parental leave is on the table, it shouldn't be a debate. It's an investment in people. That's right. While I'm done having children, I pray my voice has a positive impact on future parents. In closing, paid parental leave is not just a benefit, it's a strategic investment.
Time.
It reduces turnover costs, absenteeism, burnout, and hiring expenses. It can increase.
Thank you, Mr. Ricketts. We appreciate you. Do we have Ms. Jessica DiStefano online? Last call for Mia Haney on Zoom. Thank you. Next 3 speakers, Megan Benedict, Alani Mosley, and Lakeisha Ford. Megan Benedict, Alani Mosley, Lakeisha Ford. Do we have, I believe we do have Mr. Matthew Barbie on Zoom. Mr. Barbie, can you hear us?
Yep, can you hear me?
Yes, welcome.
Thank you. So good evening, my name is Matt Barbie and I serve as the Director of Regulatory Affairs for the Pennsylvania Home Care Association. We represent more than 800 home health, home care, and hospice providers across the Commonwealth, many of whom serve thousands of older adults, individuals with disabilities, and medically complex children right here in Allegheny County. Let me first say we deeply appreciate and support the goal of expanding access to paid parental leave. However, I'm here today to urge careful consideration of the unintended consequences this proposal could have on Medicaid-funded home care providers and the thousands of individuals they support throughout the region. As currently written, this proposal would function as an unfunded mandate for Medicaid providers. Medicaid providers, one the home-based care industry simply cannot absorb without corresponding reimbursement increases. For many providers, the financial impact would be severe enough to threaten their continued operation. The economic reality is really straightforward. Home care organizations that serve Medicaid participants operate within a fixed revenue environment. Unlike the private sector, our providers cannot increase prices to offset rising labor costs. Reimbursement rates are established by the Commonwealth and are largely outside of the provider's control. In Allegheny County, the Medicaid reimbursement rate for Medicaid personal assistance services is currently just $19.32 per hour. This is the lowest rate in Pennsylvania. From that amount, providers must cover wages, benefits, payroll taxes, training, supervision, clinical oversight, compliance requirements, administrative operations, and countless other costs associated with delivering safe and high-quality care. There is simply no flexibility within the current Medicaid funding structure to absorb an additional 18 weeks of paid leave and more sick time without dedicated financial support. In fact, the Commonwealth's own 2025 study found the Medicaid personal assistance services reimbursement rates are already approximately 20% below the level necessary to adequately support care delivery. Adding significant new labor mandates without corresponding funding would push many agencies beyond their financial limits. These consequences would be immediate and very real. First, agency closures would become increasingly likely, in particular among small and mid-sized providers that lack the financial reserves.
Time, thank you.
Thank you, Mr. Barbie. We appreciate you. The next speakers, Emily Martins, Kayla Calabro, and Alice Pinchback. And on Zoom, Alexis Bovalino. Do we have Emily Mertens in the room? No. Kyla Calabro?
She's out in the hall.
Oh. Miss Emily Mertens? Welcome. Thank you.
All right, hi. Thank you for the opportunity to speak. My name is Emily Mertens, and I'm with McGee Nurses United. I'm also a nurse with UPMC. I experienced my own set of challenges postpartum and having to go back to work in a hospital during COVID barely 2 weeks after my first, and having zero PTO in my bank was stressful, to say the least. A repeat of many things that lots of people have already talked about. Research has shown that paid parental leave improves the health and well-being of both parents and children, supports stronger family relationships, and can lead to better long-term outcomes for child development. The United States is one of the few high-income countries that do not guarantee paid parental leave at a national level. And international examples demonstrate that paid parental leave is both achievable and beneficial. Countries such as Norway, Sweden, that are not utopias, with robust paid parental leave policies, often experience better maternal and infant health outcomes, higher workforce participation among parents, and greater gender equality and caregiving responsibilities. They figured it out, we can too. And by adopting a paid parental leave policy, the United States would join other developed nations in supporting working families, strengthening economic security, and promoting the well-being of future generations. Yes, it's our choice sometimes to have a child, but short-term disability doesn't equal paid parental leave. It's a choice for companies not to support their employees. Thank you very much. Thank you.
Miss Kayla Calabro? Welcome.
Hello. My name is Kayla Calabro. I'm a mother of 2 daughters living in Allegheny County. I'm here today because I know firsthand how quickly a family can be pushed into crisis when a parent experiences serious medical complications and having to become a new parent at the same time. When I was pregnant with my youngest daughter, I was re-hospitalized a week after giving birth because of postpartum preeclampsia. And my postpartum preeclampsia, I had no idea that I had it. And then once I, found out that, it was a thing that could happen, I spent a week away from my daughter in the hospital, and she could only come visit me as a visitor with my ex-husband or with her aunt. I have missed out on so many experiences by having to go to work while being a new mother. Additionally, there were times I was trying to physically recover, mentally recover, and there's no substitution for the time that you don't get back. I think that I'm 100% in favor of, the paid parental leave, and supporting families in Allegheny County. Thank you.
Alice Pinchback.
Good evening. My name is Dr. Elise Pinchback. I am the Executive Director of Black Women for a Better Education and a mother. I'm honored to stand alongside a coalition of advocates, McGee Union nurses, community members, and elected leaders in support of the call for paid parental leave for all Allegheny County residents. The mission of Black Women for a Better Education is to ensure that Black children in this region receive the high-quality education they need and deserve. We understand that the education of our children begins long before they enter a classroom, parents being their first educators, and strong partnerships with parents and caregivers play an integral role in student success. Policies like paid parental leave directly contribute to improved physical and mental health outcomes for new parents and children by providing a strong foundation at birth upon which our educational systems can build. This is particularly important for Black families, as Black mothers suffer from severe maternal morbidity at more than twice the rate of white women. Additionally, Allegheny County's infant mortality rate is worse than the state average, and Black infants are more than twice as likely to die than white infants. In a region where academic outcomes for Black students have been perennially poor and where racial, economic, and health disparities are some of the worst in the nation, it will take a collective efforts of all of our systems to improve the quality of life for Black families. Paid parental leave is an important step in addressing the health and economic security of working families in Allegheny County while laying the groundwork to improve educational outcomes. Let's put our families first and pass this policy. Thank you.
Thank you. Do we have Alexis Bovalino on Zoom? Ms. Bovalino, can you hear us?
Hi, I can. Can you hear me?
Yes, welcome.
Thank you. My name is Alexis Bovalino. I am an employer and mother. While I believe that your organization's heart is in the right place to support new parents, the current proposal for the Paid Sick and Parental Leave Act falls short to create a win-win for parents and organizations. My concerns are that creating quality jobs does not mean the same thing for everyone. The expanded labor costs create immense operational hardships on businesses, and paid time off is simply not a holistic approach. I have a 7-month-old son, you might hear him on this call, and I love being a mom. I also love doing work in our community that I feel matters, from volunteering with my choir to serving on my university's board to supporting my employees as a thought leader. Getting back into my routine after giving birth was important for my mental health and sense of accomplishment. My mom was like that too. She got her doctorate and continued working with 2 kids under 2. Fostering supportive family practices means different things to different people. When you create a blanket policy like 18 weeks of time off, you set the stage that this is necessary for everyone. I genuinely believe my contribution to my place of employment matters, and policies like this makes me expendable. If you were to ask me what Allegheny County could do to support me as a new mom, it would not be to pay me to stay away from the things I love. Flexibility in working hours, teleworking arrangements, open lines of communication, and transparency from the workplace can help foster a deep sense of trust and support as we navigate this next chapter in our lives as new moms. As an HR professional, I strive to create policies that support my team. Understanding their needs instead of assuming is an important step, and I'm happy to discuss some of the things that we do at work to support our new parents. We take the time to listen to the unique needs and to help find solutions for different needs. A one-size-fits-one approach is important. When employers bear the brunt of labor costs associated with extended time off, there's less room in the budget toward people working. While a new parent may benefit, the person filling the role may not, which lowers the quality of the job overall and can create a competitive disadvantage for small businesses. In the UK, leave policies are actually paid by the employer but reimbursed and subsidized by the government. It's funded by the taxpayers. And to force the employer to bear the weight of this responsibility instead of banding together as a community is short-sighted and fails to recognize the need for familial support from a community at large.
30 seconds.
Based on these concerns, I respectfully request that the application is denied in its current form and would like to propose the following. A new survey of the local community to better understand the hurdles of new parents, like the All In Allegheny County initiative, and to create a task force of business owners, employees, and taxpayers to define a win-win solution that would solve this problem and foster a community of support. Perhaps there is another way to fund this program, similar to the prenatal to 3 approach,
Time.
in which both workers and employers contribute by payroll deduction.
Thank you, Ms. Bovalina. We appreciate the comments. The last call for Ms. Jessica DeStefano on Zoom. Thank you. The next 3 speakers in the room, James Giemma, Jacob Cribbs, and Lindsay Harvey. And on Zoom, we have Julia Clems. Great. Do we have Mr. James Giemma in the room? Jacob Cribbs? Lindsay Harvey? Oh, okay. Do we have Megan Benedict? Last call for Alani Mosley. Lakeisha Ford. All right, we'll move on to the next 3. I'm sorry, we'll go to the Zoom. I apologize. Ms. Julia Clems, can you hear us?
She's here in person, actually. She's out in the hall.
Yes, can you hear me?
Oh, okay. Yes, we can hear you.
Okay, wonderful, thank you.
Thank you.
Thank you. Of course, my name is Julia Clem, and I am here to support the paid family and medical leave program through the HB 200. Right now, our state is facing a severe workforce crisis. We are losing our best talent and tax revenue to neighboring states like New Jersey, Delaware, and Maryland because they already guaranteed paid leave. Your priority is keeping Pennsylvania economically competitive. Paid family leave is a pro-business, free market solution to do just that. Look at a funding structure by utilizing an employee-funded social insurance model that we can cap payroll deduction at under 1%. This means 0 direct costs to business owners and 0 state budget appropriation. It is entirely self-funded. Second, this protects our small businesses. Major corporations use private wealth to offer massive leave benefits, coaching our local workforce. A state-facilitated pool allows small business owners to offer that exact same benefit, leveling the playing field without destroying their overhead. It reduces turnover, which costs businesses roughly 20% of a worker's salary to replace. Finally, this saves taxpayers dollars when workers have financial stability during a medical crisis. They do not rely on public welfare or state-funded Medicaid. Data shows that 67% of registered Republicans and 78% of small business owners support this exact approach. Paid family leave is not a mandate on the business. It is an economic defense strategy that protects our economy, our employers, and our families at 0 cost to the taxpayer. And also, I just would like to share a quick story. My son is now 30. When he was born, I delivered him on Friday and went back to work that Monday.
30 seconds.
Because there was and even though I was married, it still was struggling. We were a new family. The cost of daycare wasn't allowable in our budget. So to have something like this would alleviate stress, will alleviate postpartum, will alleviate so many issues within a family. So I thank you for hearing me out, and please pass the HB.
Thank you, Ms. Clem. We appreciate that. This concludes the speakers on Zoom that signed up, so we will now only focus on the speakers in the room. We'll move on to the next three. We have Aaron Kramer, Daniel McCarthy, and Amber Stenman. Aaron Kramer, welcome. Thank you.
Thank you. Good evening. My name is Erin Kramer. I'm a Squirrel Hill mom of 3 who stands today in support of the proposed initiative to establish a new county standard of 18 weeks of paid parental leave. As a person who has carried, delivered, and nursed 3 babies, I've spent over 5 calendar years, 10% of my life, 20% of my adult life, physically attached to my children. I've worked through all of my uncomplicated pregnancies right up to the date of my relatively uncomplicated deliveries, and I have gone back to work after having the privilege to spend several months at home with my newest uncomplicated, beautiful baby. I've been lucky. I've been given the gift of the most routine pregnancies, deliveries, and infancies. I am an expert in my own experience, and despite that lucky history, I am here to tell you that the experience of being a new mother in this country is barbaric. It is fitting that we are here before the Board of Health to establish this standard for parents and babies. I don't need to tell anyone here that Allegheny County is facing a public health crisis. More qualified people than I will tell you how this initiative will address that public health crisis. I'm also not here to advocate for babies, as much as I love babies. I'm a birthing parent here to advocate for parents. We have a law in the Commonwealth that values the postnatal bond between a mother and her babies. This law allows for an 8-week period during which the mother and her babies cannot be separated. Unfortunately, the only mothers who have this protection are dogs. So let me repeat that. Our current system of protections and regulations value the bond between a dog and her puppies more than the bond between a parent and their child. Of course, this proposal will benefit children. Additionally, this proposal will benefit mothers. This is a proposal that will strengthen families and our entire community. Ultimately, this is a humane initiative in an inhumane world, in an inhumane country. What could possibly be the objection? Is it that our current economic system can't handle it? Our current economic system, which provides for not a single day of paid parental leave, requires women to exclusively bear the burden of early child care? Our current economic system, which requires working class women to weigh the economic security of their paycheck against their own physical and mental health? Our current economic system, which asks working class families to choose between being able to afford diapers and the physical, emotional, and psychological security of their newborn baby. Our current system, which denies working, non-birthing parents the time to bond with their children and then villainizes those parents who are not fully present for those same children. I object to our current economic system. It is bad for parents. It is bad for babies. It is bad for our humanity. Put families first, and please support the paid parental leave.
Hear, hear. Thank you. Daniel McCarthy. Thank you.
Good evening. My name is Dan McCarthy, and I'm an organizer at Just Harvest. Just Harvest works to address hunger in Allegheny County at the root, economic injustice, and we do this through a focus on public policy, food access, direct services, and community power. I'm here today to speak in support of paid parental leave in Allegheny County. So at Just Harvest, we help folks apply for SNAP, and we connect them to other public benefits programs. And so far this year, our SNAP application rate has doubled compared to last year. More people in Allegheny County are struggling and need assistance to afford the cost of living. Connecting them to SNAP can help cover periods of transition or instability, and one of those common periods of financial strain is when a family welcomes in a new baby. In fact, I often speak with community members that have to apply for SNAP and other benefits just to make it through these periods of unpaid leave, whether it's to care for family members, care for themselves, or immediately following childbirth. Trying to stitch together a web of FMLA, disability, WIC, or other programs just to support your family cannot be the solution. Paid parental leave would give families the opportunity for a strong start, taking the time to heal and bond with their babies, adjusting to life with the new human without the stress, pressure, negative health impacts, and financial burden of unpaid time from work. So new parents shouldn't have to worry about losing their paychecks or their jobs just to give birth. In fact, new parents shouldn't be forced immediately back into work to risk their own health just because of lost income. The paid parental leave could eliminate one of these major financial strains for working families at a time when costs keep rising. Without this, families are at risk with food insecurity. They're at risk of losing housing if they end up taking the choice to take care of themselves instead of go back to work. Allegheny County has the ability to improve the lives of working families, the health of mothers and infants, and improve the economic resilience of our county, all through paid parental leave. I'm confident that the Board of Health and County Council can implement a paid parental leave program that works for employers of all sizes. I would like to urge the county to address this crisis and to enact paid parental leave. Thank you.
Thank you. Amber Stenman, welcome.
Thank you. My name is Amber Stenman. I'm here with my husband, Andrew, and we're here today to support 18 weeks of paid parental leave for Allegheny County families. Last year, my husband and I decided to start a family. We were fortunate enough to become pregnant after just a few months of trying. We were overjoyed. We bought parenting books, talked about names, and imagined what the future could look like. That joy lasted exactly 1 week. After experiencing some concerning pain, I went to the West Penn emergency room where I learned that my pregnancy was ectopic. It's a life-threatening medical emergency. I'm so glad that I listened to my body and got the treatment I needed before it escalated to internal bleeding, but I still required surgery and now face a high-risk path to parenthood. After my loss, I was able to take time off work to recover, but many workers cannot. Most aren't even granted a single bereavement day for pregnancy loss, which is a loss our workplaces and society often prefer not to acknowledge, but one that is heartbreakingly common. Today, my husband and I are still trying to build our family with the help of a reproductive endocrinologist. We move forward with cautious optimism, hoping that the next time ends with a healthy baby in our arms. But even in that best case scenario, the status quo is not enough. For many families, 12 weeks of unpaid FMLA leave isn't really leave at all. During an affordability crisis, most working people cannot afford to go without a paycheck, and when a parent or newborn faces medical complications, the idea that 12 unpaid weeks is enough becomes even more disconnected from reality. Paid parental leave is about more than recovery from childbirth. It's about giving families the time to bond, heal, and emotionally support one another. It's about ensuring a father or a non-birthing parent can be present for midnight feedings, doctor's appointments, diaper runs, meal preparation, and the countless moments that shape a child's earliest days. We know those first months matter, yet the United States remains one of the only wealthy nations in the world without guaranteed paid family leave, while many other countries provide 6 months to a year or even more of paid family leave. We can do better. Allegheny County is in a unique position to have the opportunity to lead, to recognize that families are not a luxury, but rather the building blocks of healthy communities.
30 seconds.
Children deserve a strong start, and working families should not have to choose between financial stability and caring for the people they love the very most. When my husband and I finally welcome a child into our family, we will want to spend every possible moment with them. That shouldn't be a privilege reserved for the wealthy. It should be a right afforded to every working family. I urge you to support 18 weeks of paid parental leave. Thank you.
Thank you. Thank you. Before I move on to the next three speakers, I'm asking for the last time, calling out James Ruigema, Jacob Cribbs, or Lindsay Harvey. Okay, we have next Caroline Rose Agostino, Stephanie Fellow, and Andrew Wilkinson. Caroline Rose Agostino, Stephanie Fellow, Andrew Wilkinson. Welcome.
Thank you. Good evening. My name is Stephanie Fellow. I live in Plum,
and I'm a proud executive board member of our state's largest grocery store union, UFCW 1776 KS. I wanted to share my struggles with becoming a mom to illustrate why I'm a strong supporter of paid parental leave. When I had my son 8 years ago, I didn't have any paid parental leave from my employer at all. I had tried to sign up for short-term disability, but there was an issue with the paperwork, and I ended up not getting it. The insurance agent felt so bad, he raised $800 from his church to support me. I took the full 12 weeks of unpaid leave under the Federal Family Medical Leave Act and had to rely on friends and family for meals. Working parents should not have to rely solely on our social networks to support us. We should also be supported by our employers. I'm sure I speak for most parents when I say becoming a mom has been the most rewarding and the most difficult experience of my entire life. I've had so many physical, financial, and mental health challenges. When you have a baby, your life is turned completely upside down. Keeping that baby fed and healthy becomes your only priority. I was very committed to breastfeeding and somewhat committed to cloth diapering, but it took a lot of trial and error to do it successfully. When I had to return to my job, I needed to pump at work. I had to keep the pump parts clean and sanitized. That, in and of itself, is very time-consuming, let alone keeping your house clean and paying your bills and getting to work on time. I breastfed at the bargaining table with my 1-month-old baby. I was actually removed from the schedule when I returned to work because of being late. Sometimes I would have to turn back around and go back home and get my pump parts because I forgot them. On top of the difficulties caring for my baby, I developed gallstones and had to have my gallbladder removed. I also struggled with perinatal mood disorder. Bringing new life into this world and making sure that life can thrive is very, very tough work. We need to support the moms and the dads of our country as much as possible on that journey. As working families are struggling more than ever with the rising cost of living,
30 seconds.
This is a matter of not only health justice, but also economic justice. Thank you. Thank you.
Thank you. Andrew Wilkinson.
Good evening. My name is Andrew Wilkinson. I stand before you today and with my wife Amber, whom you heard from, to urge you and to urge County Council to pass this legislation. My story is one that has become common recently. I was accepted to a graduate program at Carnegie Mellon University in 2014 in computer science. Living in Pittsburgh had a lot to offer, and upon graduation, I happily accepted a local job with a big tech company and put down more roots. Let me be clear, I am one of those quote-unquote highly skilled tech workers that Allegheny County has sought so hard to attract over the past couple of decades. 10 years later, I am recently married, have recently bought a house in the middle of Pittsburgh, and am eager for the next step. My current employer is headquartered in another state, and I work here remotely. I choose to stay here working remotely because I can, because I like it here. We want to raise a family. We want to do it in Pittsburgh, but there's a problem. My employer offers 0 parental leave of any kind for either parent while earning nearly $1 billion in revenue yearly. This is barbaric and inexcusable. My state, county, and city of choice currently offer no parental leave protections. This is also barbaric. What's our excuse? I want to be the best parent I can be when the time comes and the best husband I can be. That means I need to be present for my baby. That means I need to bond with my baby. That means I need to be able to relieve my wife when she needs me. And it also means I need to continue earning money to support us all. It's 2026. All these things and more are a father's role. No one is here to help. I don't have parents who can take over. Without laws in place to force my employer to be moral, they will not simply choose to offer parental leave. So without this, I'm stuck making an impossible choice: either earn enough money while relinquishing the ability to bond with my baby and help my wife, or take FMLA and go quickly broke while knowing I'm giving my child as much care as they deserve and that I owe them as a father. We don't live in a time and place where the one parent works and one parent provides childcare model is feasible or relevant for new parents.
30 seconds.
Something must be done if this city, county, state, or even country intends to remain affordable for regular working families. We need this legislation yesterday. But I'll settle for this year so I can be covered. This amount of paid parental leave is a moral imperative and is the least you can do. Thank you.
Thank you. Thank you. We will hear next from Benjamin Knob DiNardo, Christina McCarthy, and Emily Neff. Do we have Benjamin Knob DiNardo?
You couldn't make it.
I'm sorry?
He couldn't make it.
Okay, thank you. That helps me not go back. Christina McCarthy?
She's ill.
Thank you. Emily Neff? Welcome. Thank you.
Hello, thanks for taking the time to hear everyone tonight. My name is Emily Neff. I was born and raised in Plumboro, and now I'm a resident in the city of Pittsburgh. I'm the policy director at Trying Together, a local early childhood nonprofit. We advocate for policies and practices that center babies and children with a strong system of support for the caregivers, including parents and early educators. I'm also a new mom. Just recently navigating parental leave, returning to work, and securing childcare. My son is 6.5 months old and will finally begin childcare next week. Yes. Fortunately, I was able to take parental leave for the first 12 weeks of my son's life, and then my husband was able to take time off and still is to care for our child. Trying Together supports paid parental leave. A true continuum of care begins with paid family leave. Most child care providers do not enroll infants until they are at least 6 weeks old. Even then, infant care is the hardest for parents to find. Given the lack of availability of infant care and the constraints on the child care system, paid parental leave for 18 weeks could be transformative for families and caregivers in the county, ensuring babies have care from parents without creating financial hardship. Beyond the logistical and financial challenges of starting or growing a family, it's an absolute health necessity. My time off provided the essential time required for physical recovery and healing following a scheduled C-section because my baby was breech. I tallied up the number of doctor's appointments in the first 18 weeks of my son's life, 15, between child well visits, postpartum follow-up with my doctor and doula, and multiple specialty referrals. I can't imagine that I or any parent would have been a productive employee if I had to miss out or put off a heart ultrasound because I didn't have paid time off for a follow-up appointment, which thankfully made us aware of a heart condition that we'll be able to monitor annually for the rest of my son's life. I understand you will hear from many different perspectives raising concerns. The childcare sector is made up of small businesses with financial constraints, including high staff turnover, recruitment and retention struggles, but the early educator workforce, like any other workforce, deserves the opportunity to take care of their own babies, given they have dedicated their lives to taking care of all of our community's children. I'm hopeful that employers with concerns can offer ideas for how we can make paid parental leave workable. There are solid examples of implemented parental leave programs in several states, from social insurance designs similar to unemployment or disability insurance to private parental leave insurance. And so ultimately, if we want to be a region, to be a place where people stay and we want to attract new talent, we need to center babies and families in our decision making, both in the public and private sectors, and paid parental leave is a part of that infrastructure. Thank you.
Thank you. Thank you. Marshall Robinson, Tyler Clem, and Thomas West. Marshall Robinson? Don't know if I'm saying it correctly.
You did. Thank you.
Thank you.
Can I just start, or?
Yes.
Okay.
Good evening. My name is Marshall Robinson. I'm a mother of 3 and have worked in the healthcare field for almost 2 decades. Both experiences have shown me firsthand why paid parental leave is essential for the health and well-being of parents and babies. I currently work as a registered nurse on the high-risk postpartum unit at McGee, where I care for some of the sickest and most medically complex mothers in our region. I want to speak about my experience as a high-risk postpartum nurse. I see firsthand how unplanned circumstances during the postpartum period can affect the family's ability to care for themselves and adjust to life with a newborn. My patients cannot help that they experience complications that lead to lengthy recoveries. They cannot help a diagnosis of postpartum preeclampsia. They have no control over mastitis, severe postpartum depression and infections, or other serious postpartum complications. Yet they are fighting to recover. Bills continue to pile up, and I've cared for mothers who are terrified, not just about their health, but also about losing their jobs and their income or even their homes. We all know that with the rising cost of housing, groceries, childcare, and everyday necessities, surviving on one income is becoming harder and harder for working families. Too many mothers are forced back to work before their bodies have healed. As a result, we see preventable complications, worsening mental health, and mothers readmitted to the hospital during what should be a time of recovery and bonding with them and their newborns. This issue is personal to me. I had my first child at 19, working full-time and attending college full-time. I had a difficult pregnancy and a difficult delivery, and I didn't have the time or the support I needed to recover. Ultimately, I lost my job, all while struggling with severe postpartum depression. With my second child, I did have access to better parental leave and partial income replacement. The difference was life-changing. Some worry about the cost of paid leave, but as a nurse, I see the cost of not having it every day. We pay for it through poorer health outcomes, preventable complications, and families being pushed to their breaking point. Paid parental leave is not a luxury. It is a public health issue. It is an investment in healthier babies, healthier parents, and stronger families. Most importantly, paid leave is essential for addressing the infant and maternal health crisis and making sure all working families can thrive, because no parent should have to choose between their recovery and their paycheck, and their families shouldn't suffer because of that. Thank you.
Thank you, Ms. Robinson. Thank you, Ms. Robinson. Tyler Clem, welcome.
Hi, thank you so much for being here. My name is Taylor Clem. I'm an ancestral wellness educator, a mother of 3 children, and a small business owner. I support this proposal because I believe how we care for families during the earliest days of life shapes the health of our entire community. I have welcomed 3 children into the world, and I know firsthand that birth is not something a woman recovers from in a few days. When my first child was born in 2017, he'll be 9 in 2 days. I'm so grateful for him. I worked for a small nonprofit with only 3 employees, including myself. At the time, our executive director was considered ahead of the curve because he offered me 16 weeks of paid parental leave. It was an incredible blessing that allowed me time to heal and bond with my baby, which sometimes mothers never get the chance to do so. But that still wasn't enough time, because when it was time to come back, I asked him to work remotely because there was no childcare available for him, and also if I could bring him to the office when I had to be there, and he happily allowed that. Again, a huge blessing that most parents do not get. But I also remember my partner having to return to work only a couple days of taking off. While I was grateful for the time I received, our family was still adjusting to all the things that a newborn required, and it was just not enough time. From an ancestral wellness perspective, our ancestors understood something that we have largely forgotten. Birth requires time. In many traditions, mothers were encouraged to remain close to the bed for 40 days after birth. Family and community members surrounded them with nourishing food, practical support, and protection so they could focus focus on healing, breastfeeding, resting, and bonding with their baby. And even after those first 40 days, the need does not disappear. A baby is still developing trust, attachment, and connection. A mother is still healing physically, emotionally, and spiritually, and families are still finding their footing. Yet in our modern society, many parents are expected to return to work before the healing period is complete. Paid maternal leave is not simply a workforce benefit, it is a public health investment. If we are being honest, 18 weeks is not enough. No policy can fully replace the village our ancestors once had.
30 seconds.
But 18 weeks is a powerful step in the right direction. This proposal is not simply about time off. It is about recognizing that bringing new life into the world is valuable work. It is about investing in the long-term health of children, parents, and our community. How we care for families during the earliest days of life reflects the values of our community. I encourage the council to invest in families and recognize that postpartum period deserves protection, not pressure. Thank you so much.
Thank you, Ms. Clem. And my daughter turns 9 in 2 days as well. Thomas West. Welcome, thank you.
Good evening, and thank you for having this hearing tonight, Director Van. My name is Thomas West. I'm a small business owner, and I am here tonight because this proposal is something I am being asked about constantly by people in the business community across Allegheny County. I want to be clear from the start. I understand the goal. The first months after the birth, adoption, or placement of a child are not ordinary months. They matter for children, they matter for parents, and for families. No serious person should dismiss that. But I also believe that a proposal of this size deserves serious questions before it becomes law. Not political questions, practical questions. The kind of questions that determine whether a policy works in the real world or whether it creates consequences no one intended. The first question I hear is, what is the full cost of compliance for small and mid-sized employers? For a large institution, an 18-week paid leave mandate may be difficult, but it may be manageable. But for a restaurant, a child care center, a small manufacturer, a salon, or a professional office with 5, 10, or 15 employees, the math is very different. They may have to pay the employee on leave, pay another worker to cover the shift, and still keep the doors open. Has the county completed a serious cost analysis by employer size and industry? The second question is, how will this be implemented? Business owners are asking about timelines, documentation, intermittent leave, existing leave policies, remote and hybrid employees, and how this interacts with federal law, state proposals, and current benefit plans. Those are not excuses, those are the operating details. And if those details are unclear, the smallest employers will feel the uncertainty first. The third question is, why is this the right level of government and why is this the right process? This proposal is moving through the Board of Health because it is being framed as a public issue. I understand the argument. But when a rule affects every major or every employer in the county, public and private, large and small, people deserve to understand the legal authority, the enforcement structure, and where county council fits into the final decision. So tonight, I'm not asking the board to ignore the needs of families. I'm asking the board to fully answer the questions being raised by the people who will be responsible for carrying this policy out. Good policy should protect families without blindsiding employers. It should be clear before it is mandatory. It should be workable before it is enforceable. And it should be shaped by the people who will have to live it every day. I strongly urge the Allegheny County Health Department and Council to meet with business owners and then go back to the drawing board. In its current form, this proposal will have detrimental unintended consequences and is simply not sustainable. Time. Thank you so much.
Thank you.
Thank you. We have Tamara Dixon, Erica Winger, and Lee Carroll. Welcome, Ms. Tamara Dixon.
Yes, good evening. My name is Tamara Dixon. I'm a mindfulness facilitator. I am a mother. I'm a first-generation college graduate 2 times. I'm the first homeowner of my cousins. I'm the first at many, but I want to center humanity just for a second and take a pause and a breath at why are we really here in 2026, why we have still not made enough progress in 2026 when we've made a ton of progress in other ways. And I believe that not one person has the answer or solution, but I come today not just representing myself, but the women before me, the men before me, those who have stood in these places and spaces so that I can be here today. I am usually encouraging people to pause and breathe, but families shouldn't have to hold their breath while wondering how they'll pay their bills, while caring for new children, supporting a loved one, or navigating a loss. My role at Pittsburgh Brown Mamas as well as a community manager, which is a mission to elevate the collective Black mothering experience. In Allegheny County, the numbers have already shown how they feel about that. By building community, expanding social capital, amplifying the voices of Black mothers, and creating spaces where Black moms and families feel seen and heard. Through my work, I have the privilege of hearing directly from mothers every single day. I hear from moms formally and informally who return to work before their bodies have healed, moms who are navigating postpartum challenges in silence, moms who are caring for sick loved ones, managing their own health needs, or grieving a loss while still expecting to show up as if nothing has changed. This is America. Paid leave is not a luxury. It is a public health issue. It supports maternal mental health. It supports infant bonding, family stability, workforce retention, and healthier communities. I won't go into all the research and numbers because that's just above my pay grade. I just want to be a mom, a dope human who cares about people, and not just my people, but the people after me. I feel a responsibility not just to consider myself, but what's in the best interest of the collective, not the collective just now in 2026, but my son who is 15, AKA my roommate, when he decides to have a family of his own, what that will look like. I want to be the grandma who goes and visits and supports him, but I don't want to be his primary means. I have had tons of privileges being educated and being able to plan when I decide to bear children.
30 seconds.
However, not everyone has that same right or same access. So I encourage you to remember your why and remember humanity at the center of it all. Thank you.
Thank you, Ms. Dixon. Is Erica Winger here tonight?
No.
Thank you. Lee Carroll, welcome. Thank you for being here.
Thanks. I'm Lee. I live in the city of Pittsburgh, and I'm here to ask you to support paid parental leave in Allegheny County. I had my first baby a year ago, and I had about 5 months of parental leave. This allowed me to take on one of the most raw human experiences of my life and do it in the most healthy way possible. And that meant a lot of things. It meant that when I was desperately trying to soothe an inconsolable baby with my cortisol spiking at 3 a.m., not just 3 a.m., but 12 p.m., 1 a.m., 3 a.m., 5 a.m., is a much different thing when I know that I can rest the next day and versus when I know I have to get up for work in a couple hours. It also meant I had time to make sure that my baby was getting enough nutrition at my breast before I had to think about pumping to store up milk for daycare. And also, I love my job. After adequate time off, feeling like I'd figured out the basics of parenting and nourishing and communicating with my child, I was eager to return to work I care about. What was unique about my leave was that my husband was also home the entire time as well. He had timed it between jobs. And this meant so much. Having leave with my husband meant that we were both around to adjust to new housework routines in a shared way. I know so many couples where the wife with some leave accumulates all of the baby care and house chores, and then they never quite get redistributed when she goes back to work. Having my husband around meant that he was there to lift things and make meals and check my incision as I healed from a C-section. Having him there meant that he didn't become a secondary parent. He knows our baby just as well as I I do in his own particular way. It means that our son got chest naps on his dad every single day, and our son will grow up understanding that men are caring and communal and can do drywall as well as do the laundry. And so many dads get a bad rap for not being present, so let's actually make it so that they can be around. We've been hearing a lot from businesses, and I just want to be clear, I think we all know that it's big box stores and corporations that hurt small businesses. It's not parents who want to have more time with their newborns. So let's absolutely help our small family businesses, but let's not let this be a reason that we miss this incredible opportunity to put Allegheny County at the forefront of what I hope will become more nationally widespread. I grew up in Pittsburgh knowing that it was a shrinking city. Everyone would say it's past its heyday. People were doing everything to attract young people and families. So if we still care about that, let's do this and really show the region that Allegheny County does love its babies and families. Thank you.
Thank you. Adam Stokes. Okay. Thank you for that. Gabe Kramer, welcome. Thank you for being here. And next, Caitlin Hendrickson will come right after. Thank you. Mr. Kramer, welcome.
I'm Gabe Kramer. I live in Squirrel Hill. I'm a father of 3 children. And I want to start by saying that I come from a family with fairly traditional gender roles. As a young man, I maybe held a baby 2 or 3 times in my life, and I never changed a diaper until nurses in the hospital taught me how to teach a diaper with my youngest child. I credit, in no small part, paid parental leave, allowing me to learn how to be a hands-on and engaged father who is bonded with his children for the rest of their lives. I have another relevant experience, though, which is that from 2023 to 25, I lived in Brisbane in the state of Queensland in Australia. And for those who don't know Brisbane, it's a rapidly growing city. I lived in a neighborhood full of brand new cafes and restaurants from all kinds of backgrounds, vibrant, growing tourism and hospitality sector, roaring construction sector, robust higher education and research sector, healthcare growing as the largest employer, and with advanced manufacturing and logistics. Brisbane and Queensland was recruiting talent from across Australia and around the whole world. It was a center for foreign investment and entrepreneurship and small business development. And this in a country where all workers are provided as a couple up to 24 weeks or 120 days of paid parental leave that can be shared between that couple, or if it's a single parent, they get the full 120 days themselves with freedom to schedule it. Australia is a capitalist country. The state of Queensland and the city of Brisbane both have conservative governments, right? But I would put it to you that it's a norm now in that country, and all of that thriving economy takes place in the context of paid parental leave. And let's be blunt, it was no one business or no one business sector that brought paid parental leave to Australia. They didn't advocate it as employers. They certainly, just like in this country, did not come together to encourage higher public revenue to pay for it with taxation. In fact, it took working people, a labor movement, working women coming together to say this is good for public health and society. Let us make the whole society organized around it, right? They had to carry the business community kicking and screaming to a state of prosperity that they enjoy now. We can do it too. If we work together, we can have an environment where business grows and working people and working families can take care of their children. Thank you.
Thank you. Caitlin Henderson. Okay. Amy Raslevich. Wow, that was really good. Ariana Moore and Jean Stone.
Welcome. Thank you. Sure. Thank you to everybody who's still here. Good evening. My name is Dr. Amy Raslovich. I'm a mother of 2 amazing adults and a professional who over the last 40 years has worked in and studied the U.S. health care services and social support systems and policies such as they are. I hold a PhD, an MBA, a Master of Public Policy, and a Bachelor of Science in Economics, all focused on the business of healthcare and health policy. I want to tell those listening to this testimony the same thing that I tell my university students. If you're interested in understanding why a policy may be supported or opposed, follow the money. Yes. Companies succeed and fail based on their profit margins, period. Executives are compensated based on their bottom lines, period. These companies and people lobby, pressure, and fund elections and policy considerations, and therefore have great influence on the decisions of public policymakers. So let's talk about the bottom line. Quantitative studies in the U.S. have overwhelmingly found increases in productivity, profitability, revenue, market cap, and net income, and decreases in turnover and related expenses for firms with PPL policies. Surveys in states with mandates have found employers, large and small, overwhelmingly in favor of PPL. Over 90% of California employers found positive or neutral impact on employee turnover, productivity, and morale, as well as profitability and corporate performance. New Jersey employers found no negative effects on profitability or difficulties with mandate compliance or administrative burden, and 67% of their small businesses reported that they suffered no increases in overtime pay. Most large and small employers in Rhode Island were in favor of the mandate a year after its implementation, and a year after their mandate, small firms in New York found no negative impact on employee performance or difficulty in managing long absences. In fact, the firms found increases in employee commitment and cooperation. Ernst & Young found that more than 90% of companies with PPL reported either a positive or neutral effect on morale, profitability, and productivity. In mandated states, multi-firm companies do not move across state lines, and in fact saw productivity increases compared to similar firms that were across state lines. If we look at turnover costs, where the median expense of replacing an employee is about 25% of their annual wage, climbing to almost 150% for some salaried positions. Google extended PPL and new mothers, and the company's attrition fell by half. For Accenture, 40%. For Aetna, retention went from 77 to 90%. I will say that the gentleman who spoke about plan design and public plans and administration is absolutely right. The policy design and context is critical to the beneficial outcomes for families and businesses. But research shows that small businesses, the outcomes for businesses and families is a boogeyman. They are not going to suffer. Workers deserve as much protection as businesses large or small. Thank you.
Thank you. Ariana Moore, welcome. Thank you.
All right, good evening. My name is Ariana Moore. I am a Pittsburgh parent, a full spectrum doula, a business owner over those doula services, and a senior at Carlow University studying neuropsychology. Thank you. I am here tonight in support of paid parental leave. Oh, that sucks. A paid parental leave because I've seen firsthand what happens when families are given the time they need to recover, bond, and adjust, alongside, unfortunately, what happens when they are not. As a doula, I work with families during one of the most significant transitions of their lives. The weeks following birth are not simply a time of celebration. They are a critical period of physical recovery, infant development, and mental health. Yet too many parents are forced to return to work before they are medically, emotionally, or financially ready. This is also a matter of maternal health and safety. Many of the most serious risks to mothers occur during the postpartum period, including cardiovascular complications, mental health crisis, and other conditions that can become life-threatening if they go unrecognized or untreated. While paid parental leave is not a cure for these challenges, it gives parents the time and flexibility to attend medical appointments, seek care when complications arise, along as focusing on recovery during the vulnerable period. The research is clear. Paid parental parental leave is associated with improved maternal mental health, lower rates of postpartum depression, increased breastfeeding duration, stronger parent-child bonding, and better health outcomes for infants. It also benefits employers through improved employee retention, reduced turnover costs, and increased workplace loyalty. As a neuropsychology student, I am especially aware that early relationships shape lifelong development. We know that secure attachment, responsive caregiving, and the parental well-being contribution to healthier outcomes for children is crucial. Paid leave helps create the conditions that allow families to build this foundation. Beyond the data, when a child is born, families should not have to choose between financial stability and caring for their newborn. Recovery for child care is not a luxury. Bonding with a child is not a luxury. Supporting parental mental health is not a luxury. These are investments in well-being of families and ultimately in the future of our communities. As someone who has supported families professionally and lived these experiences personally, I can tell you that the need is real. Every family deserves the opportunity to welcome a child without immediately facing economic hardships or impossible choices. I urge and encourage you to support parental leave, and I thank you very much for listening to me tonight. Have a good one.
Thank you. Jean Stone, welcome. Thank you for being here.
Thank you for allowing me the chance to speak. My name is Jean Stone. I'm a proud union nurse specializing in maternal newborn health at McGee Women's Hospital. I've spoken here a couple of times on this subject. Tonight I'm going to use my time to read a statement from my colleague Erica Winger, who was not able to be here because she's providing care in the emergency department. My name is Erica Winger. I am a nurse practitioner at McGee Women's Hospital, where I have worked for the last 15 years helping countless women on their journey to motherhood. I am here today for the non-traditional parents, such as myself, who required surrogacy in order to have a family. I was entitled to 2 weeks of 100% paid parental leave by UPMC, who is the leader of women's health care in Western Pennsylvania. They take pride in providing excellent care to women in the community, however, have lacked significantly in supporting their own female workforce, who make up approximately 75% of their total employees. In my scenario, I did not qualify for a short-term disability leave because I did not birth my baby. So I had to drain my PTO bank and then go unpaid after my insignificant 2-week parental leave. Surrogacy in general is a very expensive process and one that many cannot afford without financial assistance. So imagine being off work without pay while also paying your surrogate's lost wages on a nurse's salary. And then try to imagine bonding with a baby that you did not carry while worrying about the financial burdens of this process. The parental leave in Norway is 49 weeks at 100% pay. Can you imagine a world in which we get a parental leave like this? Or even one that is recommended by the leaders in infant maternal health in our own country. The United States as a whole is drastically behind on parental leave. Allegheny County has a chance to become a leader in what is morally and ethically right in order to protect our infants and their families. I urge you all to do what is right by voting yes for mandated 18 weeks of parental leave. Thank you.
Thank you, Ms. Stone. We're almost on the last stretch. Courtney Clem, Holly Bazart, and Marie Kamala Norman. Courtney Clem, welcome. Thank you for being here.
Thank you. When I had my first baby, my partner and I had to save and set aside our vacation days just so we could spend time with our newborn. He only had enough time saved for 1 week. I was paid for 2 weeks and then went on to short-term disability. By the end of that leave, I was already feeling pressure to come back to work, even though I was still recovering and trying to figure out how to be a new mom. Businesses often provide only as much leave as they're required to. I worked for a company that offered a generous salary, generous bonuses, and management that was far better than what most workers experience today. And even with those advantages, they still refused to properly fill my position. I repeatedly communicated that my goal was to remain home for at least 4 months, and instead of preparing for that possibility, my employer chose to take the risk that I would return early and then place that pressure onto me. I was the only support person for a high-level employee in a role that realistically required 2 full-time positions with specialized training. They didn't take the time to hire and train a replacement before my leave, even though I repeatedly urged them to and offered to do the training myself. Instead, they brought on a rotation of part-time temporary employees that can never fulfill all of my tasks. Going back wasn't easy, even though it was just part-time to start. My son was a breastfed baby, and the daycare that I worked with wasn't very accommodating. Suddenly, a baby who had never had an issue taking my milk was struggling. He would refuse bottles, he would refuse to sleep, and he would spend hours crying before I had to leave work early and go pick him up. When I took him out of this daycare, my employer decided to let me bring him to work instead of giving me more time off to make the adjustments that we needed. I was trying to balance work, motherhood, breastfeeding, my own recovery, and my baby's separation anxiety. Eventually, it became too much and I just quit. And this isn't just an issue for mothers. My partner missed out on so much during these first few months, experiencing the growth of his child through photos and retelling of milestones and cute things that happened throughout the day. He wanted to be there and he wanted to bond with his son, but because he only had a week off, he had to return to work almost immediately and missed out on this essential bonding time. Now we're expecting another baby, and I'm a stay-at-home mom this time, and while I'm grateful to be home, I'm also preparing to care for a newborn and a toddler, mostly on my own. The first time around, even with some support, I barely had time to focus on my own health and recovery. Thinking about doing it again reminds me of how important the support of the second parent really is. Welcoming a baby into this world shouldn't come with the stress of rushing back to work or losing critical bonding time. Parents need time to heal, adjust, and be present for moments they'll never get back. Paid parental leave is an investment in families, children, and healthier communities. And I hope you'll support these policies that ensure every parent has access to this time and resource. Thank you.
Thank you. Next, we have Holly Bazart. No. Marie Kamala Norman. Amy Witzel. Welcome. And Michael Meager. Dr. Witzel.
Thank you, Dr. Vaughn, and thanks everyone for staying. Good evening. My name is Dr. Amy Witzel. I'm a board-certified maternal-fetal medicine physician, a graduate of the University of Pittsburgh School of Public Health, and a member of both the Pennsylvania Maternal Mortality Review Committee and the Allegheny County Fetal and Infant Mortality Review Committee. I'm also a mother of 2 children. For more than 30 years, I have cared for women and families during pregnancy, childbirth, and the postpartum period. I am here today because paid parental leave is not simply an employee benefit. It's a public health investment that can improve maternal health, infant survival, workforce stability, and health equity in Allegheny County. The data tells us we have work to do. According to the Allegheny Health Department, Black infants in our county die nearly 4 times the rate of white infants. This disparity is larger than we see nationally. The Allegheny County Health Department's review showed that Black families accounted only for 16% of the births in the county. They represented approximately 80% of preventable infant deaths. The report identified maternal health and prematurity as the largest contributors to excess infant mortality. As a physician who cares for high-risk pregnancies, these findings are not surprising. The weeks after childbirth are amongst the most vulnerable times in women's life. This is when the mother needs to be monitored for severe hypertension, hemorrhage, infection, blood clots, and postpartum depression. It is also when parents must attend multiple medical appointments for the birthing person and the infant. Parents need time to heal, establish breastfeeding, and care for newborns who may be premature or medically fragile. Yet many parents are forced to return to work before they have recovered physically or emotionally because they cannot afford unpaid leave. Establishing quality, affordable, and available infant care is almost impossible. Paid parental leave can help change that. Research shows that paid leave is associated with lower rates of postpartum depression, increased breastfeeding, improved attendance at postpartum and pediatric visits, and better infant health outcomes. It allows parents time to recognize warning signs of serious complications before they become life-threatening emergencies. For families with premature infants, paid leave allows parents to participate in NICU care, attend follow-up appointments, and provide the stability that supports healthy development. Paid parental leave can also help address inequities. Families with lower income are the least likely to have access to paid leave and are often forced to return to work earliest. By providing income protection during the postpartum period, paid leave helps reduce barriers to health care and supports families who face the greatest risks. But if we are serious about reducing preventable infant deaths, improving maternal health, supporting mental health, reducing prematurity-related complications, and addressing inequities documented by the Allegheny County Health Department, paid parental leave should be part of the solution. As a maternal fetal medicine physician, a public health professional, and a member of committees dedicated to preventing maternal and infant health deaths, I urge Allegheny County to support policies that expand access to paid parental leave for all parents. Healthy pregnancies leads to healthy births lead to healthy families, and healthy families are the foundation of a healthy Allegheny County. Thank you.
Thank you so much. And our last speaker, Michael Meager. No? All right, this concludes the number of speakers that we had tonight. I just want to thank everybody for signing up, engaging, being here. I appreciated all of the comments and the stories and the thought process that exists. That is the reason why we have this process, so we can take all of your comments and suggestions and make this a better process. So please be reassured that we're going to take all of these comments, including the over 500 comments, written comments that we have received so far, and incorporate that into the process. I do want to remind everybody that the written comment portion remains open until Sunday, June 17th. So there is still a little over 10 days for written comment to still be provided to the health department, and we have our team members that are looking over every single comment, and we will provide responses to all of those comments. It doesn't matter if it's going to be 500 comments or 1,000 comments. We encourage everybody to engage in this process, and we're appreciative of everybody providing us with support. So again, thank you all for being here. It was a great 3 hours spent with you. Thank you.